CCDF administration. Those ones follow a little bit more of the traditional model. They're all gonna be great. Then we have a plenary, then everyone gets to go home again. Well, not home, but you know. All right, I promise we're almost done. Thursday looks largely the same as Wednesday. The only two differences are that the Promoting Informed Childcare Choices session, we are not currently planning on offering that on Thursday morning, so if you want to attend, I would recommend Wednesday. And the topic of the fundamentals is going to focus on fiscal fundamentals. So we're doing program fundamentals Wednesday, fiscal fundamentals Thursday. Otherwise, I think the agenda is pretty straightforward based on everything that I've told you so far, so I will let you think about it, peruse it, and if you have more questions for any of us about the agenda, just let me know. All right, did we get to everything? Oh, I think so. Let's find out. Oh, great, okay, so speaking of us wanting to make sure that you have strategies, ideas, and tools that you can take with you from this meeting, you will likely have found that in your program packet, we have a final rule implementation companion tool specifically for this meeting. And I am not gonna talk about it, but Mel Banks is. I know, right? It's a fun group, very good-looking people.
I know, when they asked me this morning if I wanted, not this morning, they asked me a while ago if I wanted to talk to about 500 people, and I said, ooh, you know, that makes me a little nervous, but I get to sit next to Trisha Haley, who is the most amazing presenter, so I just want to say thank you to Trisha.
When you get to talk about the STAM agenda.
I know,
then,
right?
Yeah.
It's so exciting. So, as Trisha said, we have, if you look in your packet, it's the black and white printout, several pages. 2024 CCDF Final Rule Implementation STAM Companion Tool. It's a mouthful, so I have taken to calling it the Final Rule STAM Tool. Oh, so if you look at your Final Rule STAM Tool, you'll see that we've given you some opportunities to make connections during this, the next couple of days. We know there's a lot going on. I mean, we just went over a very packed agenda. You all have a lot going on. I mean, just from walking in the front door of this conference and even seeing people in transit yesterday, we know that you all have a lot to think about, right? So I'm like getting some feedback here, huh? So we wanted to help you think about how to navigate through these next couple of days and how to really make the connections to what's going on in your states, your territories, and to each other, because we know that there's people back home. I saw a couple of folks are here, maybe just one or two of you from your state or territory. So we know that you're gonna wanna carry a lot of things home from this conference to the folks that are really doing the work back home. So we thought that we would put together a tool to help you think about that. This is a new tool, and we are, as Trisha said, open to feedback. So I'm really interested to hear at the end of STAM how this tool worked out for you, if it was helpful, how we can improve it in the future, because I think this is something that we could probably carry forward to future STAMs. Just a way to track what's happening, what you're hearing, what connections you can make, and what you need to do to change things when you get home to implement elements of the rule. So if you open the tool, you'll see a little overview up front. First of all, one of the first things that you may see is that there is not a ton of room to write. I don't know about you, but when I'm thinking, when I'm making connections, I'm scrawling. I'm a big note person. How many folks here like pen and paper? Yeah, a lot of us, right? We've been in the game for a little bit. We're notebook people. Yep. What about how many folks are on tablets this morning or laptops and really like to capture things digitally? Yeah, a fair amount, and I think that number keeps growing. So we tried to do something for all y'all. And if you can't tell, I'm from Kentucky. I'm gonna drop a lot of y'alls and folks and things like that. So for all y'all out there, we wanted to make sure that you had something that worked for you. So you have this printed tool, and we tried to give you as much room as you could to write notes. But you can also go to the resources tab in STAM or on the STAM app and download a fillable PDF version that should give you a little bit more room to type if that's what you prefer. Has anybody been in the resources tab yet this morning? Oh, there should be something there. Are you in the app or are you in the, okay, so you may need to go to the website. So for the resources page on the website, it is there. I checked this morning. Thank you for letting us know that. Okay, it's there. Now we just got confirmation. It is on the app. Good.
This is like real-time user testing. Thank you.
I know, this is great. This is what I do. I'm with the consumer education team, so we're getting good feedback live. So please download that PDF, use it to type or take notes. But let me walk you through the tool really quick, just so you know what we were thinking when we designed it. And then again, we want feedback from you and let us know if we can improve it in the future. So on the second page, if you look at page 2 of the tool, you'll see that it lists the new requirement of the 2024 rule. So you'll see the goal on the left-hand side, and then we bulk those, the new requirements into the goals. And then we give you space to think about different elements of application for that rule. So first of all, in the column right after the rule, you'll see related STAM sessions. So what we did is we went through the agendas, we talked to folks that were presenting, and we said, are you talking about this new element of the rule? And can we list your session? These are the discussion sessions, these are the conversation pods, they're the breakout sessions. You won't see the plenaries listed there. The plenaries tend to be kind of broader, more all-encompassing topics, but that doesn't mean that if there's not a session listed, that we won't talk about that specific element. So it could be you go to a session that's not listed on the tool at all, and you end up talking about that element. But we just wanted to give you kind of some prompts to think about. If you came with a big team and you're wanting to split off and go in different areas, if there's specific elements of the rule that you're interested in talking about during STAM and learning more about, you can use this tool to maybe identify a session to go to specific to that rule element. So that should be helpful in deciding what sessions to go to. Then we ask you to think about your current status. So for instance, if you're on page 3 and you're seeing pay providers based on enrollment, you know that you could probably go to discussion session 2, which I think is the paying by enrollment session, and learn a little bit more about that. It's a discussion session, so you'll be able to talk to other folks. It's a real conversational piece about paying by enrollment. So we gave you a little space to think about, what are we doing there? Where are we? Are we already paying by enrollment? Do we have a plan? Have we started to activate certain elements of that rule? What's our current status? Who's involved in it? And then thinking about kind of change management principles, where do we want to go? We know that we want to meet that requirement, but what does that look like for our lead agency? Because we know it's going to be different across different states and territories and just your different systems. So where do we want to go and how do we do that? Who do we need to talk to? Who needs to be in the room? What budget allocations are we going to need to make this happen? I mean, there's a lot of questions. So this is an opportunity to start thinking about those questions and also just a prompt to actively listen for that when you're in your sessions. Because you're going to hear, hopefully, if we did our job right with the agenda and the planning, this is all about connections. It's all about hearing what's happening across the board and creatively solving and collectively solving for these approaches. And then next steps. And you may not come away with next steps. I hope you've got some when you leave STAM, but this may be a tool that you need to take home to the folks when you get back, and you can talk to everyone on your team, and you can talk about implementation, and you can really think about what the next couple of weeks, months, year is going to look like as you implement these different elements of the rule. And then we gave you a big old space for connections and takeaway, right? So who else is doing this work? Are there people that you want to set up maybe a phone call with when you get back? Did you talk to some TA folks that maybe could help you implement some of this work or help you think about it or help you make connections? This is a great place to write down names, write down phone numbers and email addresses, and then write down, I'm going to pick on Kansas because you were so enthusiastic. I talked to somebody from Kansas and they had something really great to say about this certain element. So make sure you don't miss those connections. We should be giving you time at the end of every session to complete this tool. So that's a challenge that was put out to all the facilitators, was to say, you know, let's give folks a couple minutes and let's remind them that this tool exists, and to get names and phone numbers and things like that. Because we know in the moment when you're conversing, when you're really part of a session, that might not be the best time to be writing down all that information. So hopefully at the end of every session, you can think about the fact that we have this tool, and you can make sure you capture names and things like that as folks are walking out the door. The other thing that we want you to think about as part of this, and as you're thinking about implementing these rules, are these cross-cutting topics. So I'm actually going to go back a slide if we can.
You guys go back one.
Thanks.
Thank you.
Thank you. So as you're implementing, I think it can be easy to get lost in the details, and we need to implement this rule. We need to make it happen. What are the steps for this specific element? So one of the things that we're hoping this tool can help is to remind you of the systems approach, right? So when you change something somewhere, is it going to change something else? Are you thinking about these overarching topics? Do you have the data and the systems that you need in place to capture the information that may or may not change as you implement this rule? As you change this rule, are you thinking about how it can help build equality and equity across your system as you bring new people into the system, as you think about its applications? You know, how are you gonna monitor this new rule? Are there program implications and program quality implications, program integrity implications? Are you catching all of the different populations in your state and your territory as you make these changes? So not just focusing on that individual piece, but thinking about it as a system, as a whole. How are you going to communicate about these changes, right? Because we know, like, if you build it, they will come. That's not quite true. You all have built a lot, and sometimes it takes a little bit of extra effort to make sure that folks know that things are changing, that there's new opportunities and new ways to access the system. So thinking about how you're going to get that information out there. So that's what the last couple pages of the tool cover, is those cross-cutting topics. So you'll see, like on page 5, we talk about data and technology. And we gave you some, again, related STAM sessions, and then also some prompts to think about as you're evaluating your system as a whole and as you're making changes. So, you know, what changes are needed to the IT system, what updates are required for data sharing agreements, those types of things. So we hope you'll take a minute to read those prompts even before you go into the very first session at STAM, so you can keep these elements in mind. So that being said, I think that's everything that I have. Don't forget, again, that we don't, you know, there may be a session that's not listed. Show up to those conversation pods in the morning if you can, if you don't have another session. Talk to each other in the hallways. Don't feel like you just have to use this tool when you're sitting here listening to folks talk. You can use it at dinner, when you're out with your regions. You know, just take those notes, put them in your phone, and then transition them later. And then remember that this exists when you get back, and introduce the folks back home, your program people, your partners, your vendors, you know, to transfer your knowledge here at STAM to the folks that are gonna put this, you know, put pen to paper when you get home. And I know all of you are gonna do that too, but I know you all can't bring the folks that you want to STAM to hear all this great information. So feel free to share it. It is digital, so you can send it to whoever you want. The folks back home that are watching us remotely, we hope you'll do the same. And I think that's all I have, unless anyone has questions about this tool. All right,
Awesome.
Thank you.
Thanks, Mel. You're welcome to stay. You can go back down, whatever you want to do.
Go back.
All right. And I will tell you this: if I see any of you at a restaurant with your STAM tool out, I will bring you a literal gold medal. Like, that's next level. All right, thank you so much to Mel and the team for both putting this together, and also for giving you all a little break from hearing from me. I promise you, we are almost done preparing you for this meeting that I'm sure you are just now so excited to get into. We have just a few more things. So I told you, we're leaning hard into the QR codes. If, as you are experiencing this meeting, you are thinking to yourself, oof, you know what? I really need some TA on that. We have a QR code for that. It is somewhere in your program. Whoever finds it first gets a high five from me. Which page? What page? Page 4 at the bottom. Yes. Great work. I will high five you later. So you can, it's just a different way to request TA. So Chad and Nathan on our TA tracker team have put together a form that leads directly into our TA tracking system. It will follow the exact same steps as if you were to just email a state system specialist or a TAL or your regional office. This is just one more door. We try to create as many doors as possible into TA supports. This is a new one, so feel free to avail yourselves of it. We're really excited about it. All right. Now, you may have noticed that in our sort of foyer lobby area, if you weren't super distracted by the coffee, maybe you were, that's fair, we do have a few information tables out there. One of them is with our Office of Planning, Research, and Evaluation. If you don't know, OPRE is the research arm of ACF. As you can see on the slide, they build evidence, they evaluate programs, they partner with OCC, they do a tremendous amount of work related to CCDF, and they are a fantastic resource. So feel free to go out there, visit that team. They will be out there. Here are some resources that you can learn more about. So they're the best, they're great, go talk to them. We also, if you're really feeling the research, have some representation from our colleagues at Research Connections. Again, tremendous number of tools. We have some ways for people to walk you through some of those, talk to you about what might be most helpful to you. They are fantastic. Again, they've got this QR code at their table. So you can, if you're, like I said, leaning hard into the QR codes, this one is gonna be right out there for you. And last, but of course not least, we are looking for folks, as we did last year at STAM, we got some really good feedback related to our TA website. We are hoping that some of you, if you end up with a little bit of time, will sign up for a time slot to let us know how our YouTube video page is going. We know it's not great. So we're gonna try to fix it. My colleague, Angelica Montoya Avila, and the TA division has been working with us to try to put some kind of organizational structure so that these videos are actually helpful and not just sort of a weird potpourri of what you might find. But we need your help to do it. So if you've got some time, talk to us, schedule just a 10, 15-minute interview. And it turns out, based on this bullet, that they have candy, which I'm not actually sure is allowed, but I'm gonna look the other way, because we really need your input. So please do feel free to jump in on that. And now, if you thought this meeting was fun before, buckle up, because we are introducing, like I said, we know that we are competing with the Olympics. We have decided to create our own version of the Olympics. We are introducing this year the STAM 2024 Jargon Olympics. So you will get to vote. So the way that this came about is that one of our TA network teams in March did a March Madness of jargon, right? So there's all of this jargon that we all use all the time. Teamwork makes the dream work. Synergy, 10,000-foot view, move the needle, thought partner. All of these terms that we use that, well, let's just say they're jargon, right? So they did a March Madness of jargon, reached the final, everybody had a really good time, was really engaged, and I do think it's a really interesting way for us to think about some of the terminology and jargon that we're using. Also, it's just fun. So we are going to give you all the opportunity to vote. It's gonna be, let me make sure I got my notes right, because Dave on our team put this together, and I don't want to lead anyone astray. So they have 16 examples. You're gonna vote in sort of 4 kind of brackets. That's today. Then tomorrow, we will find out who our top 8 are. They will move on to the final medal round, and you will vote again tomorrow. Which example of professional jargon will win the gold? We don't know. But I think we're all gonna be really delighted to find out. So there is going to be a, so there, surprise, surprise, there's a QR code for that. I will tell you, this one is the only one that is not anywhere else, but Dave is going to, during the break, drop off sheets of paper that have the QR codes for each day of voting so that you will have them. We will be announcing our finalists tomorrow. I know you can't wait. It's going to be great. So do feel free, like I said, during the break we'll put papers around so that you can vote, and you will have that opportunity. Who's excited? Everybody? Yes, it's going to be great. Okay, I think that brings me, thankfully, to the end of my presentation. So I don't know if we have Ruth here. Is she here? Sounds like not yet. Okay, you know what? That's fine. So we're gonna take 8 minutes. Maybe we'll get our Jargon Olympic papers out a little early. You can spend a little time voting, maybe fill up your coffee, and then when we hit 10 o'clock, we will bring Ruth up to talk a little bit about her part of this. So anyway, thank you all. I know there's a lot of information and a lot of it is not that fun, so I really appreciate everybody being here and doing this.
I get up, time is barely on our side. I don't wanna waste what's left. The storms we chase are leading us, and love is all we'll ever trust. Yeah, no, I don't wanna waste what's left. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go. On we'll go, finding life along the way, melodies we haven't played. No, I don't want no rest. Echoing around these walls, fighting to create a song. I don't wanna miss a beat. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go. And we'll grow in number, fueled by them to see the horizon, turn us to thousands. And we'll grow in number, fueled by them to see the horizon, turn us to thousands. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go.
Good morning, everyone. Can you please find your seat? Folks in the back of the room. Oh, yes, we could do clapping. Thank you, my early childhood partners, for introducing some classroom clapping. Good morning, everyone, and welcome. Thank you so much for making the time to be here with OCC and our TA partners and with all of your peers. It's so great to see so many familiar faces. I hope your travels were uneventful. Oh, I heard one laugh. I'm going to take that as a no. We are hoping our time together. Ooh, that's terrible. Should this not be on green since I'm on here? Okay, all right. I won't touch anything. We're hoping this gives us time to connect, to reconnect, and partner in the important work that we all share. Tricia asked me this morning if I had integrated the Olympics into my remarks, and sadly I have not. She was disappointed. I would just, out of common courtesy, ask that no one discuss the gymnastics results this afternoon, because some of us will be going back to our TV wanting to not know what happened. I do want to quickly start by thanking OCC staff and our TA partners for their efforts to put together this convening for you. Our Deputy Director, Anne-Marie Toohey, also was very involved in the development of this week and very much wants to be here, but she is about 10 minutes away at home with COVID, so unfortunately she is here in spirit, but not body with us. I do want to give a special shout out to Tricia Haley, who oversees our state and territory TA. It is her leadership on that work and her efforts that bring us here today. She somehow manages to take everyone's input while keeping both her sanity and her humor and pulling together another really great agenda for us. So throughout this week, we're going to have many opportunities to discuss implementation of the final rule, including best practices, as well as time for open conversations about challenges and barriers that you're facing or anticipating. I know Tricia had a chance this morning to share how this year's STAM program was developed and encourage everyone to really share their experience in breakout sessions, and I do just want to double down on that request. We know that you're waiting on additional guidance from OCC on the final rule, and we will be addressing some of those questions in the very next session. And there are other places where we are still working out some details and expect to issue more guidance this fall. So for the purposes of this week, our intention is that STAM really focuses on peer learning opportunities, tools, and strategies to help you start moving forward with your implementation on the rule. And we're pairing that with opportunities to learn and discuss how we can continue to center a child and family well-being in our work and find more strategies to further leverage CCDF to strengthen the broader child care sector. And so today, I am going to focus a little bit differently than I usually do. Usually when we're together, I spend the time trying to discuss where we are on rules and regulations, our priorities, including our own efforts at CQI here at OCC and the work we're doing to try to be a better partner to you all. But this morning, I'm going to zoom out a bit and look a little bit more broadly at child well-being, which is, of course, the center of the work that we all do every day. We know a lot about what children and families need from research and from implementation experiences. Consistency, routine, responsive interactions, secure attachments are all central to building a strong foundation for child well-being. But we have also recently learned that we need to be highly adaptable and willing to reevaluate and redesign our approaches in childcare to meet emerging needs. I remain amazed and grateful about how this community here collectively responded to the urgent needs of young children and their families that were necessitated by the COVID-19 pandemic, your support for the childcare sector, and your response to pretty impossible circumstances. And now we are in this phase of taking back what we've learned to build stronger practices into our childcare programs, into our childcare systems, so that we can collectively be meeting the needs of children, families, and the childcare workforce. So at ACF, we have also been taking a hard look at how we can drive toward better well-being outcomes for children, families, and communities. This generally coincides with the Biden-Harris administration directing us to make mental health a significant priority. To meet that charge, HHS developed something called the HHS Roadmap for Behavioral Health Integration. The roadmap outlines commitments to providing a full spectrum of integrated, equitable, evidence-based, and culturally appropriate behavioral health care to the populations that we serve broadly at HHS. And for us in the early childhood space and the Administration for Children and Families, we're really focused on supporting the behavioral health of children and their caregivers, which of course includes the workforce. So in particular, in response to the roadmap, we have developed a goal of increasing behavioral health knowledge and access to ECE programs to meet those needs. And to achieve those goals, we have a few different buckets of work. We are looking to enhance TA to support early childhood mental health. We are looking at ways to leverage all available funding sources from across the government to support ECE programs. And we are working to review and update our policies to strengthen mental health supports. To achieve these goals, we have been working closely with partners across HHS and also with our partners over at the Department of Education to make sure that we are identifying opportunities for collaboration, identifying funding sources, and sharing information. So we at OCC want to be supporting you on your efforts to strengthen children's social and emotional development and their caregiving environments early on. So towards this end, we are working along our CCTAN, our center's mental health subject matter experts who have developed a work plan of mental health strategies and action, which includes multiple activities to support OCC's mental health priorities. Additionally, I do want to bring your attention to another effort that OCC is engaging in partnership with the National Center on Health, Behavioral Health, and Safety and the Office of Head Start, and that is an effort around infant and early childhood mental health consultation. Later this fall, OCC will be conducting a national scan of the early childhood mental health consultation landscape. The scan is meant to help us learn about the availability of these services in childcare settings, how they're funded, where the gaps are, what the barriers are in implementation, and who the key points of contact are in each state or region. So as part of this scan, we will be sending out a survey to all CCDF lead agencies, and we really would appreciate if you could take a few minutes to complete it. What we learn from this survey is going to help us enhance our TA efforts in this area and better support you in integrating early childhood mental health consultation. I also wanted to make sure that you guys had seen that we had put out a series of information memoranda around the issue of mental health. So collaboratively across OCC, the Office of Head Start, and the Office of Early Childhood Development. We developed a suite of 4 IMs focused on promoting mental health and well-being in children, families, and the workforce. And designed together, these cover all of the early childhood programs that we implement at ACF. So that includes CCDF, Head Start, the preschool development grants, and tribal home visiting program as well. The IMs are intended to take a comprehensive and cohesive approach to promoting mental health. And for one of the IMs speaks very specifically to how CCDF funding, how our regs and CCDF goals can support mental health strategies. So the IM includes a bunch of strategies specifically for CCDF, so that you are aware of some of the flexibilities that exist in the law that might be useful to you as you think through your own approaches in your state or territory on how you might want to be addressing mental health issues. We also, just very quickly, with the Department of Education, put out a joint policy statement on inclusion of children with disabilities in early childhood programs. This is aimed at supporting really needed collaboration across system partners. And we know that you all are doing lots of really important work in this already. I am picking out just a few. There are many more examples. These are just some things that we've pulled from state plans. We know, for example, in Idaho, in collaboration with their IDEA Part C program, they've been conducting developmental screenings in childcare programs statewide. They're using the Ages and Stages questionnaire and have a system where the referral is automated so that early intervention services are scheduled and delivered. Really innovative work. We know that eligibility criteria often excludes children and families who could benefit from services. And so in Idaho, to ensure access to those services, home programming for infants and toddlers and their families is provided when there are concerns about a developmental delay, but they may not yet be eligible for services. Really excited to see Idaho lead in this way. In Alaska, for another example, they are focused on trying to make sure every community in the state has access to early intervention. No small feat with such a large state. So they are leveraging the services of their statewide CCR&R network, Help Me Grow Alaska, 211, and the Infant Learning Program to ensure that both families and child care providers have access to information and resources about a variety of services, allowing eligible infants and toddlers to receive services in child care settings when that setting is willing and the family is interested. We're also seeing innovation in the territory of Guam. In Guam, through an interagency agreement, they are deploying a series of trainings, including disability awareness training and technical assistance, assistive technology awareness, and utilization for children in child care settings. Innovative strategies like this have inspired us to be intentional about scaling promising practices and leveraging policy to create improved and more efficient services, and really appreciate the leadership that so many states are taking in this. Yes, it was worth a clap. So to continue to expand on the great work that you guys are doing, OCC earlier this year launched 2 interrelated projects that I wanted to make you aware of. It's part of an effort to support well-being for children with disabilities and with developmental delays. We really want to be doing our part to move the field forward as well. We know the child care system is an incredibly important touch point for early identification, early intervention, and for providing inclusive care settings so that all children have early care environments that meet their developmental needs. So what we have done is we have engaged the partners you see here on the screen to try to move the needle on some of the challenges in the field with the child care system. So we've funded 2 interrelated TA projects to bring together policy and research collaborators with deep expertise on these issues and who understand the importance of lived experience in designing solutions. So we are partnering with Start Early, Frank Porter Graham, 0 to 3, and Guidehouse on 2 different projects. On our side and our team, I do want to just call out that the folks specifically supporting this small technical assistant pilot are Frances Martinez-Pedraza, a clinical psychologist who specializes in disabilities and inclusion here in OCC. She's on our staff. Our Deputy Director, Anne-Marie Toohey, who has extensive experience in implementing coordinating programs, and Jennifer Park, who works as a consultant with OCC, who has extensive early childhood system building expertise. So the 3 of them, along with the partners you see here, are examining opportunities we can leverage at the agency level and implementation strategies at the local level to improve access to quality, inclusive childcare. We know that this is a challenging effort. It's going to take long-term investment, long-term engagement, but really felt like we needed to take this very intentional first step. So this text, which may be impossible to read at the back of the room, and that's okay because you will see it from us again. It's really just a broad overview of one of the 2 projects. So one of the projects is specifically geared toward developing how we can increase the supply of inclusive childcare. Community partnership engagement is the foundation for the design of this project. So in this effort, not only are we looking for state commitment and state leadership, but we are also stressing that without community engagement, we will not be able to build as an effective design as we are hoping. So we really want community and state partners to help drive the design of this TA. We will be building that strong foundation to allow us to map out how to design disability inclusion TA supports, deliver that TA more broadly, and make more progress. So it's a small pilot. We will be looking to engage some lead agencies in it with the goal of taking those lessons learned and using that as a next step so that we can all benefit from it. And then the second piece of it is focused more directly on integrating CCDF and Part C services. This slide, also a bit text heavy, but it just provides an overview of the second project, really looking at how we can help state efforts to coordinate and leverage increased access to early intervention services. This TA approach, in coordination with the disabilities inclusion approach, is meant to create a small intensive TA cohort with some of you all who are interested. We are going to be leading this, again, with our partners. We will be holding an informational webinar for lead agencies about these 2 projects next month. During that webinar, you will hear more about the projects, but also more about how you can get involved in those projects. We are looking for lead agencies who would be willing to engage in this sort of intensive TA project. So please be on the lookout for that. We're really excited about it and hope it sets the stage for more and broader work that we can be doing together to support child well-being in childcare settings. So quickly, what's next? I do want to make one final plea. You all heard me talk about this at the regional convenings. Our Data and TA Center, which we created to support lead agencies to leverage data and make IT system improvements so that we have better user experiences for families, child care providers, and of course for lead agencies themselves. We have many opportunities, I think, in the new rule where using IT well will make a world of difference. We are expecting to launch the IT scan in early August. So in the next few weeks, 2 weeks. And this is optional for you guys to do, but this is my plea to you once again to take the time to complete the survey. It sets the stage for our IT strategic roadmap plans, which is the first step in more TA on the IT data side of things. So please look for those. If you're confused, when you get them and you're confused about them, please reach out to your regional offices. We are happy to answer any questions. I will just finally note with that is it's probably the survey is going to be best completed by you and your IT partners. So if you have that collaboration at the beginning when you do the scan, that is going to be optimal. We know this is an area that you guys have asked for a lot of TA from us, and we are responding with this TA center, but we really need your engagement on this scan. And then just finally to wrap up over the next few days, engage with each other, engage with presenters, take advantage of your time face-to-face here. OCC is extremely capable staff. You've told us repeatedly that you want to learn from each other, so please take advantage of the fact that you have your peers here. We have tried to set up our sessions such that we are maximizing that. And with that, I just want to thank you for all the amazing work that you have been doing. I thank you again for your partnership, and I think I am not handing it to Tricia now, just going straight to the next. Okay, so for our next, I'm going to invite Dawn and Megan and Toya up. We are going to shift. We're going to continue the conversations that we had started during the regional meetings about plan and monitoring, and provide some policy updates around the rule so that you guys can get a good sense of where OCC is looking over the coming year.
Good morning. All right. So welcome everyone. We're going to go ahead and get started. Toya and I, as Ruth said, saw many of you during the regional meetings earlier this summer, and we decided we wanted a friend this time at this session, so we've invited Megan to join us. So we're all happy to be here. So I'm Dawn Ramsberg. I'm the Division Director of Program Operations, and I'm joined by my colleagues Megan Campbell and Toya Bryant. And so collectively, we want to provide some updates in the context of CCDF implementation and use the plan review that is going on now to be able to provide, like I said, provide updates as well as some clarifications, and then talk about where we're heading. And so I'm going to just briefly give a sense of what we're going to cover today. So we, for those of you who were at the regional meetings, but actually even earlier than that, we've been talking about how we are using an aligned approach to understanding CCDF implementation. So I'll talk a little bit about what we're seeing in the plan submissions, some reflections and observations. Megan is going to provide some final rule clarifications, and then Toya will talk about the upcoming approach to on-site monitoring, as well the phases and timeline and next steps. So in terms of the aligned approach, I'm going to, again, provide a little bit of history that we've been talking about. Yeah, I can do it. In terms of how we've been talking actually since last STAM. I think last STAM was when we first released the CCDF plan preprint for public comment, and we talked about the approach that we were going to be taking with this as far as trying to align our look at implementation. And so we have grounded kind of our implementation look at using the central CCDF policy requirements. And so rather than kind of just look at the plan on its own, or getting policy guidance on its own, or looking at monitoring on its own, we are using the policy as kind of our foundation to kind of be able to understand how CCDF is being implemented. So we refocused on these central policy requirements. So again, zooming in on affordability, continuity of care, health and safety standards, equal access, program integrity, just to name a few. But all of our work is grounded in our policy goals and kind of what we want to achieve in terms of CCDF implementation. And so that is how we've been carrying out our activities. And so again, just a refresher about how the framework looks. So in July, at the beginning of this month, we had the state plans come in, and so that is the start of our cycle. Our look at implementation happens in a cycle. It's kind of an ongoing process, but the plan kind of starts our cycle. And so again, this is kind of the way we've been approaching this. And so we want to understand CCDF implementation in terms of both the policies and implementation. And so the plan is our place where we're trying to understand the policies. So for example, do you have 12-month eligibility policies for all families? And then we will use monitoring the on-site validation as a way to understand how that policy is being implemented. So if you have a 12-month eligibility policy, for example, is it being implemented to fidelity, meaning your data systems aren't cutting off prior to 12 months, or caseworkers aren't terminating families prior to 12 months, or there's not special initiatives that give special populations like 3 months of eligibility. So that's what we mean kind of looking at implementation, both in terms of the policies being established, and that's the emphasis with the state plan, and then understanding the implementation of policy. That's what on-site monitoring is going to look at. And kind of in between, or kind of with both of these, we've introduced an appendix this time that will help us have an action plan for places where we don't see full implementation. And so to support both the plan and monitoring, again, we have our technical assistance supports, and again, these have always been kind of part of the process, but we knew that you told us, and we heard, there were both overlaps in how these different activities were working, as well as gaps. And so that's been our emphasis and what we've been rolling out over the past year, is really trying to align this framework and really, again, have policy be the driver, but then have these different activities work together. So let me talk about what we're seeing with the plans. So first of all, thank you to everyone. Like I said, a year ago at STAM, we rolled out the first draft, and in July 1st, we received all plans. And I have to say, I've been doing this for 20 years. We've always had some stragglers come in. This year, we got all the plans on time, so really want to just thank you all. So everyone's plan is in, it's under review. I know regional offices have been working and connecting with you. This is our first plan that was submitted through our CARS system. And so we have new tools at our disposal where we're able to real time be able to look at where comments are at that are going back to all of you. We're able to kind of track kind of where each plan is in terms of the review process. So it's been a game changer for us too, to be able to have this information real time. The other thank you I want to acknowledge is we are seeing implementation progress. So I know the last two STAMs, I think Ruth has presented slides where we've talked about where CCDF implementation is lagging. We are seeing progress. I am not giving you numbers or data because, again, this is all kind of a work in progress as far as the review, but I know that there is progress happening because one of the things that you all got to do as part of your plan is kind of check boxes, if you had implemented things. And so one of the things we're doing is comparing places where you have an existing non-compliance, and if you've checked yes, we are working to make sure we have the evidence to support that, but I know that those conversations are happening, so I know that there's progress happening. So again, just thank you all for the work that you've been doing to fully implement CCDF. So I wanted to set some expectations as far as what's next in August and September, and then after October 1, which is when this plan will go into effect. So again, in terms of comments, I think you have been getting some comments back, requests for more information from your regional office staff. A lot of those, just what I've been able to reflect on and observe, there's just some incomplete information where maybe we're not fully understanding kind of, what you've provided, and so we're requesting more information and just want some clarification. Again, additionally, I think requests are going out for some of that evidence or that information about implementation so that we can say something is fully implemented. And so you should expect to continue to receive those in the coming weeks. And I would just ask that as quickly as you can, work with your regional offices to get those in, because the sooner that we can kind of look at that additional information, the sooner we can kind of move through the review process. And like I said, another thing you should expect is conversations with your regional office staff. So I know one of the things in the STAM agenda this week is time each morning for you all to have conversations with your regional office. So again, having information in CARS has put us in a better position to kind of know where each of you is at. And so I know your regional offices have made time available to be able to meet and have conversations with you this week. And I just want to kind of, again, just level set that expect those conversations to continue after STAM. But again, it's to help us both build that shared understanding of what you are doing. In terms of what will happen after October 1st, so again, your new plan will become effective October 1st. we will be issuing approval letters, and it will list if there are any non-compliances. And so we have worked on in both building the plan, but also in how we're building the letter that it will communicate both approval, but if there are issues. And so I would expect, and again, this is acknowledging the feedback that you all have been giving us, I would expect that it is more clear to you both what the policy that is not fully implemented is, but then what the reason is. So we've been working to be able to articulate more clearly that if it is that 12-month eligibility policy, that we can kind of say it's continuity of care that's not fully implemented, and the reason why is because there's a group of families that maybe doesn't have 12-month eligibility, or that there's another issue with the policy. And so hopefully that helps be more clear when the approval letters come out. As we've kind of talked about over the year, another thing that'll happen after October 1 is any waiver requests as well as waiver approvals, like the window for submitting those is through November, and then we'll issue waiver approvals as part of the process of getting those requests in. The appendix, the action plan that you'll need to tell us kind of how you're going to address the non-compliances that you receive are due 60 days after you get your approval letter, so that will be in December of 2024. Cars will be available for plan amendments, and those will happen after October 1. You have to have an approved plan before you can do an amendment, so amendments happen after plans are approved, but that will be available. And then I just wanted to plug, just to make sure it stayed on the radar, is that the annual quality progress report will also be due December 31st. So just wanted to kind of put it in line with kind of information that will need to be shared after October 1. I want to just share a little bit in terms of the content that we're seeing, and this will kind of flow in, I think, to some of the clarifications that Megan is going to provide, but I just wanted to provide a few observations or places where we have been flagging a need to come back and just make sure there's clarity around policies. So in terms of reducing barriers to enrollment, we just wanted to remind folks that, again, with presumptive eligibility, it can't be longer than 3 months. So I think there's been some places where we've been unsure, or it may appear that it's longer. So if that's the case in your state, you might get a request to provide more information around that. In terms of new siblings, so if a family has another child, that new sibling also has to have 12 months of eligibility, so they can't just be added on to the first child's eligibility and kind of get the remainder of the balance. So again, there's some states that I think we're going to go back and get some clarity there. In terms of the job search and continued assistance, just wanted to kind of flag a few things that we've seen here that we will come back and ask for some clarifications on. So again, initial job search has to be at least 3 months, so it can't be like a 30-day or a 60-day, like there has to be at least 3 months. And it must continue even if a job or an eligible activity is obtained. So just again, that 90 days is a minimum of 90 days. And in terms of the number of job searches, I think we've seen a few places where job search is being limited to only like 1 time or 2 times, and then it's not provided, but there's not a limit in terms of job search. And then temporary changes, so things like maternity leave or a health leave in terms of eligibility can't result in termination of the 12 months or continued assistance. So again, just wanted to kind of offer these clarifications just based on some states that we flagged that we're going to come back for comments in terms of the eligibility policies. And then in terms of some health and safety observations, or I skipped health and safety. Just some clarifications here. Again, this is a place where we are seeing progress, so I wanted to put this out here. We are seeing most states are reporting completing monitoring or inspection reports, so that's a place that's been lagging the past couple of years. We are seeing progress in that area, so again, just wanted to acknowledge that. In terms of ongoing training, we are seeing more states that are able to report that they have ongoing training, but seeing some lagging still, that it maybe is still not for all provider types. And so that'll be a place where if there is a non-compliance, it would say that, you know, you don't have ongoing training, but then we'd be able to specify, like, is it your school-age providers or, you know, a specific provider type. There are some places where we're also needing some clarification either on the frequency of ongoing training or if health and safety topics are included. So there's a little vagueness in some of the responses. So again, you might get a request for clarification around the ongoing training. And then finally, in terms of some observations around equal access, we are seeing most states reporting that copays are below 7% of families' gross income. So that is a welcome bit of information. We weren't sure kind of where states were going to be at, but most states are reporting that. So just again, thank you for the implementation and the progress in that area. Similarly, in terms of equal access, we're seeing payment rates are increasing. So again, I think a couple of years ago, we were pretty low, and payment rates are increasing. Also, the number of states using cost-based alternative methodologies has increased from 12 in the last plan to, or from 3 the last plan to 12 this plan cycle. So again, thank you for moving towards that cost-based approach. So just wanted to acknowledge those couple of pieces. We are still seeing some places where we need some more information on the narrow cost analysis. So if your state is one that doesn't do an alternative methodology, you are still expected to do some cost analyses, and we're seeing some gaps there. So expect some follow-up in some states there. In terms of paying by enrollment, we see about half of the states are paying by enrollment. So in terms of that policy, we're seeing about half the states there, but we are seeing some states that are still saying that they require attendance or limit the number of absences in order to get payment. So there may be some clarification that we're looking for there. Prospective payments, this is a place where we're expecting most states are going to be asking for a waiver. Looks like there's still work to be done there, and folks are taking their time, and that is acceptable, but just that's kind of our observation there. And then in terms of grants and contracts, about half the states are saying that they're using them, but we're also seeing many are saying that you're going to be requesting a waiver. So again, just wanted to take the opportunity, since we are able to look at this, to just again thank you all for the progress that you're making, the implementation that is happening. Wanted to level set expectations as far as what to continue to expect the next few months. And I think with that, I get to turn it over to Megan Campbell, who is going to dive a little bit deeper into some of the final rule policy clarifications that are bubbling up that we want to share to facilitate our shared understanding.
Sorry, so my computer decided to die right before this, and it's the one time when I really need to read off what I need to say. So Dawn has kindly offered to let me use her computer. Okay. Oh, okay, I see it. Just a second. I'm gonna have to actually use my phone. I apologize, everybody. But hopefully the fact that you're getting policy responses makes it a little bit better. Okay, so, just to add a little bit, I know I had the pleasure of getting to go to all of the cluster meetings, and I know we talked a lot about questions around the final rule and not a lot of answers. We are still working through a lot of answers, but today I am lucky enough and happy that I get to share a few verbally. We will be sharing these in writing along with many more, but wanted to give you a bit of information, really focusing on ones that have been prompted by the plan reviews, the questions we've gotten through the regions, also through RTA partners, and kind of share a bit on, as you're looking to, especially if you're applying for waivers for some of these policies and looking how you'll implement them, both how we'll be, looking at the plans, and then I think it will lead into Toya talking about monitoring for these pieces. So the first couple questions we're going to talk about are related to the co-payments. So the first question, I'm sorry.
That's okay.
Thanks, sorry, okay. So the first question we have is about what if a lead agency would like to charge a flat fee for co-payments? So what if they require at least a $1 a week co-payment, for example? So the CCDBG Act does require that lead agencies have a sliding fee scale, which means that there must be at least 2 levels of parent co-payments. As long as neither tier is above the 7% cap, states have flexibility to determine those tiers. If a lead agency has a minimum co-payment amount for all families, so that $1 a week per family, that co-payment amount must not be more than 7% of the family's income. The 7% cap ensures that the upper end of the required sliding fee scale is affordable for families and not a barrier to accessing CCDF. We also want to remind you that you are allowed and encouraged to waive co-payments for families where the minimum co-payment amount would be more than 7% of the family's income, instead of prorating that $1 a week, perhaps to a minimum co-payment to be under 7%. Okay. Are there any changes to whether childcare providers may charge parents additional amounts above the required co-payment? We've gotten this question a lot, and I think it came up in the cluster meeting discussions. So no, the final rule does not change the existing flexibility that allows lead agencies to decide whether to permit childcare providers to charge parents additional amounts to cover the difference between the subsidy payment and the childcare provider's private pay rate, as long as the lead agency has demonstrated in their plan that the policy promotes affordability and access. If a lead agency does allow providers to charge additional amounts above the co-payment, the 7% cap requirement applies to the lead agency required co-payment. It does not apply to that additional amount that a provider may charge to reach the higher rate. But we are aware that this flexibility can present a barrier to access for some families and impact affordability for them. We strongly encourage lead agencies to set provider payment rates to cover the cost of care, to minimize providers' need for such policies. And as Dawn said, a lot of lead agencies are already taking steps to improve payment practices. So, sorry, this is a lot on one slide, but there are a lot of questions about prospective payments, as you can imagine. So the first one is, can a lead agency provide the subsidy payment to a parent, such as through an EBT card, that the parent then uses to pay the child care provider? So yes, lead agencies can provide the subsidy payment to the parent, such as through an EBT card, as long as the funds are easily available for the parent to pay the provider in advance of or at the beginning of the delivery of services. This is why I don't usually use scripts. Okay. Since lead agencies are responsible for meeting all CCDF requirements, including prospective payments, but can't reasonably control the parent's actions, we will be looking to see if the lead agency, if they choose to use like an EBT card or this process, we will be looking to see if the lead agency has established agreements that may look like a written agreement between the lead agency and the child care provider that includes information for the provider about how they will receive payment and what recourse they have if there is a problem with receiving their payment, or a written agreement with the parent that outlines expectations for when the parent will pay the provider, or an agreement that the lead agency requires the parent to have with the provider, outlining when the parent will pay the provider based on the provider's private pay practices. So sometimes there is a delay in direct deposit or payment delivery after the lead agency has issued a subsidy payment. For prospective payments, does a provider have to receive the subsidy payment by the beginning of the delivery of services, or is it sufficient for the lead agency to have dispersed the payment by the beginning of the delivery of services? So lead agencies must issue the payment in advance of or at the beginning of service delivery, but the actual payment does not have to be delivered by the first day of service delivery. None of us, I think, can control the banks, and that can certainly impact that. So we understand that. The next question. So for children who are new to the subsidy program, there may be delays in getting payments to providers because of the time needed to set up that child in the system, or if it's a provider you don't have set up in the system. Is it okay to pay those providers serving children who are new to CCDF after they have already started providing the services so the child does not have to wait to receive care? So the answer is, for the first service period for a child new to CCDF, lead agencies may pay the provider on a reimbursement basis to avoid delays in the child starting care, but that is just for the first week or month, depending on your service time. Okay, so the next one, we've gotten a lot of questions about the concerns, the requirement for that you cannot pay 2 child care providers for the same hours for the same child. So I did want to clarify that the 2024 final rule did not change that requirement, and there is still a prohibition on paying 2 child care providers for the same hours of care for the same time. So this is something where we will provide technical assistance on how to meet this policy while paying prospectively, and also based on enrollment, and encourage learning from your peers who have successfully implemented these policies within those boundaries. And I think that STAM is obviously a great opportunity for that. And then the last one on prospective payments, somewhat related, can lead agencies limit how often a child can switch child care providers during the service period to ensure that 2 providers are not being paid for the same hours of care for the same child? And yes, lead agencies may limit how many times a child can switch providers in a service period. All right, paying based on enrollment. First one is, can we require a child to attend up to 8 hours during the service period to establish that they still need care? While lead agencies cannot take absence days into account when determining a provider's payment, they may require a child to attend a minimum number of hours during the service period to ensure that the child still needs care. Another question we've gotten a lot is, what is authorized enrollment? So authorized enrollment from our perspective is the amount of time the lead agency has authorized a subsidy payment for the week, 2 weeks, month, or other service period. And then the next one is, if lead agencies are paying based on enrollment instead of attendance, can lead agencies still require the collection of attendance information? And the answer there is yes. All lead agencies have the option to collect attendance information to ensure children are still enrolled in the program, but as I mentioned, this must not impact the provider's payment. Okay, last one here. Is it an improper payment if we pay a child care provider for the full authorized amount, but the child does not attend every day? No. If the state's policy is to pay the child care provider the full authorized amount, regardless of a child's attendance, then the state is following its own policies and would not be considered an improper payment. Okay, sorry, I'm almost done, y'all. Okay, so for grants or contracts, do children have to be eligible for CCDF in order to be served through a grant or contracted slot? Yes, these are considered direct services. Therefore, children must meet CCDF requirements. Also, providers who have a grant or contracted slot must meet CCDF requirements in order to have one of those slots so they can serve a child participating in CCDF. And then, does funding wraparound services for early Head Start child care partnerships count toward the requirement to use grants or contracts for direct services? So this one will depend on how the partnerships work in your state. If the state is the partnership grantee, this may count, but if the state is not the grantee, it's unlikely it will meet the requirement, but we will be putting out more information. And then for the last one, this it seems a little bit different from the other rule requirements because we didn't change this, but as Dawn mentioned, we did clarify in the final rule that new children who are added to a family must receive 12 months of eligibility, and we encourage lead agencies to extend the existing child's eligibility period so that it can align with their new siblings, which would mean that the existing child, the older child, perhaps would end up 16, 18 months of eligibility. And we do, often emphasize that 12 months is a minimum, it's not a maximum. But we have gotten some questions about age when it comes to having a longer redetermination period, so wanted to share that clarification here. So for states that extend eligibility beyond 12 months to align redetermination periods with a new sibling, is it allowable for the lead agency to have a longer eligibility period for 12-year-olds, thereby potentially providing child care subsidy for 14-year-old children who are not physically or mentally incapable of caring for themselves or under court supervision? So CCDF regulations indicate that a child must retain eligibility despite a change in age, including turning 13 years old during the eligibility period. However, if a lead agency has an eligibility period longer than the minimum 12 months, it is possible that a child may turn 14 during the eligibility period. In these cases, it would not be allowable to continue CCDF services once a child turns 14, unless the child is incapable of self-care. CCDF rules allow services to children under age 19 who are physically or mentally incapable of self-care or under court supervision. Unless the child is incapable of self-care, sorry, that's very repetitive. The CCDBG Act requires children to be under age 13 at the time of initial eligibility determination to be eligible for CCDF. So we note that lead agencies with eligibility periods longer than the minimum 12 months do have the option of establishing shorter eligibility periods for children who will age out of the program in the next eligibility period, as long as the eligibility period is a full 12 months. In other words, children who are age 12 at the time of eligibility determination can be approved for 12 months of eligibility rather than a longer period. So if your eligibility period is 16 months, 18 months for a child that's 12, you could just approve them for the 12 months. Okay, and then that is it for me. And I will turn it over to Toya. And as I said, we will put all of these out in writing.
All right. Okay, so once again, hi everyone. My name is Toya Bryant. I am the division director. I know it was a lot to process, right? Megan, we need it written. Okay, so I am here today to provide a monitoring update, but before I do that, I just want to give a quick shout out to the Oversight and Accountability team. They work really hard. I want to also thank the states who submitted their ACF 404 report at the end of June. Thank you so much for getting that in on time. We also appreciate your prompt response to any follow-up questions or clarifications needed to approve your report. And if you have any questions, our team is here and available to discuss. So the presentation today is going to build on the information shared during the regional cluster meetings. And I have to say that we are making progress, but sometimes it takes a little longer than expected. So I'm sharing as much as I know and can share today, but please know that we're still finalizing the process with more training to come in the fall. So our goals for the upcoming triennial cycle are reflected on the slide. So again, our goal is to support full implementation of CCDF, to validate compliance of some key policies. We will be more responsive with a compressed on-site timeline, conducting visits sooner, more responsive in turning around our results to grantees, and we will continue to identify technical assistance. So at the start of the presentation, Dawn shared OCC's aligned framework for the coming year. So this is how monitoring fits into the aligned framework, oversight framework. So again, we are taking the 3-year cycle, reducing it to 18 months or 78 weeks. I will share more about what the timeline looks like by phase later in the presentation. The monitoring topics or scope align with the key policy priorities that Dawn shared. Monitoring, again, will confirm implementation of some plan items. We are looking to limit states' pre-visit document submission. The plan will focus on policies, and so monitoring will focus on implementation on site. So we anticipate a lighter lift for states and the teams pre-visit. Again, we are focusing on implementation on site, so that means data collection interviews with the state and state's partners, as well as more guided case file reviews, which I will share more about. And then finally, getting the reports to you sooner. So these are the monitoring topics that we will focus on for the next triennial plan cycle. Again, the topics are grouped by the policy priorities. So in order to accommodate a significantly compressed schedule, we are streamlining our activities, right, to ensure that we're able to collect the critical information we need from lead agencies in order to determine compliance with the requirements. So similar to cycle 2, our activities are grouped or reflected by phase, pre-visit, on-site, and post-visit. And so for the pre-visit, we're looking at a 75-day period. So for visits will start in March. So planning or pre-visit planning will start in January for those states scheduled in March. So we're looking at 75 days for the pre-visit. Similar to the current cycle, we're looking at having state planning calls. Again, there's going to be document submission, document review, and then we will jointly develop the schedule. For the on-site validation, we're looking at a 2.5 to 4 day visit week. Again, depending on the scope, if there are fewer items to validate, we're looking at less days on site. But again, the same kind of core components where there will be an entrance conference, the data collection interviews. We're looking at a tiered validation approach. We'll talk more about that in the presentation, but we want to speak to the lead agency or those agencies that are responsible for developing the policies, and then we want to speak to those folks who are actually implementing the policies on the ground. Again, looking at more guided case file reviews, and then there will be a exit conference or visit closeout. And then for the post-visit, which is, I would say, where we got hung up quite a bit, but we are a lot better, I promise. We are looking at completing our data analysis. There will be an opportunity to follow up with the state if there are any kind of pending questions. We're looking at the process for confirming compliance decisions and then issuing the report. So the key visits by phase. So looking at the pre-visit, we will identify the provisions that will require some level of pre-visit document submission. I'll talk more about the framework. I shared that during the regional cluster meetings. Agencies will then submit their documentation based on that framework for us to review and to have a discussion. The monitoring teams will again verify that documentation, ask any kind of clarifying questions, and then again we will work on developing the schedule together. So familiar activities similar to the activities that we implemented in the prior cycle. So this is the framework that we will use to evaluate what documents need to be submitted pre-visit. Now, during the Cluster meetings, I believe there were like 5 categories. We've collapsed them in this slide. So for the items in the blue, if you are compliant in the 25-27 plan, we do not expect to request any information for you. We will focus on on-site validation. If you are compliant in the 25-27 plan, but you've made changes since the 22-24 cycle, it is possible that we may be asking for some documents. And again, as we get into the planning period, we'll talk through those changes with you to make a decision as to what information we may need up front. And then if you are non-compliant in the 25-27 plan, we do not expect to, again, have any pre-visit document review, and we won't be validating those items on site because we're all on the same page about you are working towards full implementation, so there would be no reason for us to focus on those. For the items in gray are the exceptions. So for the items in gray, they are either new to monitoring because they're a new rule, or we have not monitored them before. So we are anticipating having some discussion pre-visit and requesting some information from you. So again, the items in gray are the exception. Provisional hire, prospective payments, if there is no waiver, enrollment based on payment, if there is no waiver, and then posting of inspection reports. And I will just flag that the posting of inspection reports was a provision that we reviewed in the prior cycle. It has since been clarified in the rule. And so again, if it's a fully implemented provision, we anticipate some pre-visit review. And it could be just looking at your website. But again, we anticipate some information being shared up front. For the on-site validation key activities, again, looking at 2.5 to 4 days, we'll have similar components, or the format or approach to the on-site will be similar to cycle 2, where again, we'll have an entrance conference, state-level interviews, local or partner-level interviews. We're looking at the guided case file reviews for both subsidy and provider records, and then having an exit conference. So we have a tiered validation approach where the lead agency or partners who develop the policies will confirm the intent of what is expected for implementation. So we want to make sure that we're kind of clear about what's expected. And then, as a part of that discussion, we will take an opportunity to validate any of the documents that were submitted pre-visit, and then also address any gaps. But then we want to have a second set of interviews with local staff or partners who are actually implementing those practices on the ground. And so it's important for us to confirm their understanding of what's expected, and also have them demonstrate or walk us through case records so we can confirm that implementation. Like cycle 2, we will be requesting a series of case files meeting a specific set of criteria. And so this slide is just a sample of the types of criteria we will be looking for under the subsidy case records or included in the provider case records. And so under subsidy, we're seeing that we would be looking for an application reflecting an initial eligibility. We would be looking for the assessment of a copayment. We would be looking for a case that had been recently redetermined, a case reflecting initial job search, presumptive eligibility if it is being implemented, and then a case closure. Again, there could be some other criteria, but this is just to give you an example of what we would be wanting to hone in on as a part of the case record. And then for the provider case file reviews, we would want to look at the annual inspections by provider type. So we would want to see an example of licensed providers, family child care providers that are licensed, in-home providers, license exempt if applicable in your state. Again, looking at the inspection results in a complaint or investigation, we want to see a pre-licensure inspection as well as an annual inspection. Since this upcoming cycle will focus more on implementation, we are looking to increase the number of guided case file reviews. In cycle 2, I think the range of cases could have been 3 or 5, in some instances 10, but we're looking at increasing the numbers. We are finalizing the criteria by which we will establish what that threshold will be for your state, but we are looking at a variation based on state administrative structure. So we know that some states may implement their program regionally, some are centrally located. So we're looking at establishing some clear criteria for determining how many records under each category will be requested by lead agency. And so more information to come. And so it could be, for example, that our minimum threshold is 12. And so we're looking at starting with 12, but then potentially increasing to 25. Again, that will vary based on the lead agency, but something that we will talk through as a part of the pre-visit planning. So this is just a sample of the format for the on-site visit, similar to the prior cycle where, again, we started on day 1 with an entrance conference and then we moved into the data collection interviews. So this would be an example of a Tuesday through Thursday on-site schedule where we're there for 2.5 days. Again, just an example of a full week or 4-day schedule, starting with an entrance, moving through the various data collection interviews and guided case review sessions, and then having a wrap-up at the end of the week. So for post-visit, again, similar format to the prior cycle where we're looking at completing the analysis of all of the data and information captured throughout the course of the monitoring process or by phase, looking at any follow-up with the lead agency, because again, there's an opportunity to provide clarification or additional information within a specific time frame. And then we're looking at the compliance recommendations. Are we recommending compliant or non-compliant based on the provision? Issuing that monitoring report, aligning as much as possible with the plan and making sure that we're articulating the reasons for non-compliance. And so it's 12-month eligibility for what reason. So we want to make sure that we're communicating at that level to lead agencies about any findings. And then after monitoring within 60 days, we are expecting that an appendix will be submitted to reflect any findings. So it could be an update or something to the existing, or it could be new, depending on if we find something that may not have been flagged in the plan. So this is just a high-level timeline or example of what the pre-visit to post-visit would look like for a visit in March. So again, starting that pre-visit work in January, looking at March being the on-site visit, so we have that 75-day period, 2.5 to 4 days on site, and then we're looking at that 60-day post-visit wrap-up with the report being issued by May, and then we would be expecting that appendix to come in within 60 days. So next steps for monitoring while we continue to finalize the process. So in August or soon, and you may have already heard from your regional offices, that your region will be contacting you to talk about your visit date. And so we're needing to establish the national schedule as soon as possible. So typically we take a, we finalize the schedule by fiscal year, but we're looking at scheduling visits for fiscal year 25 and 26. So if you have not heard from your regional office, you will be hearing from them very soon about a proposed visit date. In October, November, we're looking at formally launching Cycle 3 monitoring. You will receive a letter from our director, again, announcing the visit, talking about the goals for monitoring. We will also be confirming that visit that you will be discussing with your regional offices ahead of time. We will be rolling out training, just-in-time training for those states that will receive their visits early, diving a bit deeper into the provisions and the scope for monitoring. And then we will look at starting the pre-visit activities by January. So I'm going to pause for any questions. Thank you.
There can be questions for any of us.
Right, questions for the panel, not just me. Any questions? And we're always scheduled before lunch. So, okay, there we go.
Okay, it's on. Good morning. Felicia Gray, State of Illinois. I am wondering about the criteria. I know that you're working on finalizing it, but can you tell us if it would be like fund-based, state-based? How do you delineate who would be evaluated by specific criteria?
So that's a great question and something we are working through. I think the goal is to see or to get an example or range of how the policy is implemented across the state. And so we know that, again, one state may have workforce boards, another one may administer the program locally. We have states that are centrally located. And so I think what we're trying to do is based on how maybe expansive or diverse it's being implemented, we want to make sure that we're getting examples or a good range of how it's being implemented across the state. So that's sort of the direction of our thinking. For the subsidy records. And then what we'll do for providers is look at the provider types, right? And we have great information about how many providers states have, and so we're gonna use that to come up with some criteria to figure out what percentage of cases may need to be licensed, since most of the providers are licensed in the state. So we're still working through, it's not scientific, and not a statistical sample, but again, it's to give us a good sense of how the program is being implemented through those few examples.
Thank you.
Okay. And I was just gonna say, did I miss anything, Sherry? Okay, thank you.
Hello, Elizabeth from the state of Oregon. We just had a question about the waiver request timelines, because we know we can have until November to request them, but if you requested them much earlier, will we be receiving responses before November, or are you guys waiting for everybody to request their waivers and then responding all at the same time?
Yeah, that's a really good question. So we haven't had a lot come in yet, because we haven't officially released guidance to you all on how to, right? We've told you what needs to be in there. And so I think that we're trying to work through what we have, and can we right, we have 90 days to review them. And so it's kind of like trying to look at when you've submitted them and look at what they are. But I think with some of them, like with the plan, right, some states have said we're going to request a waiver, but it's not in there. So we would actually have to have the request to approve it. So it's a little bit rolling and a little bit fluid. I don't think our goal is to wait for all of them, but we know that we need to get guidance out officially and have you get them all in. So
Thank you.
yeah.
Hello, Bridgetta Mitchell from the state of Arkansas. Quick question, Ms. Megan, when you were given those answers, will those be provided in writing? And will we receive these slides in writing?
Yes,
I mean,
the answers will be provided in writing. Yeah.
Okay.
Yeah,
And
and you'll
will
get this, I think you'll get the slides from this session, so yeah.
Thank you.
It's always hard to look out. There's bright lights in our face, so I'm always just making sure there's not someone standing. But I don't think that I see anyone else. All three of our teams, we all have a team of staff that help us put this together for all of you. We are all here for the rest of STAM, available if you do think of questions, want to follow up. Again, or the regional offices, also, I know you all have regional meetings today, so if there's additional questions, we're happy to take those and work on them. But I think if there's not additional questions, I know Toya and I always feel like we're standing between you and lunch.
Yeah.
So I think, Tricia, do you want to kind of wrap us up? And just thanks, everyone.
Thank you.
So you guys are okay with
Sorry, maybe I should just have to.
Yeah, so there's gonna be some version of these slides online. We'll get them, Toya's gonna take a look. We'll get a version that can go up. So be excited. Even more great resources. Lucky for you, we're breaking a little bit early. We will be back at 1:30. You'll either be in your regional meetings or you'll be in here learning about DISC. And then it doesn't matter, you get to flip and do the other thing. Don't forget to vote in the Jargon Olympics. Voting closes at 5. So, all right, thanks everybody. Great job, guys. What? It was about an hour. We went till about, actually almost exactly, we went to like 10:32.
side. I don't wanna waste what's left. The storms we chase are leading us, and love is all we'll ever trust. Yeah, no, I don't wanna waste what's left. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go. On we'll go, finding life along the way, melodies we haven't played. No, I don't want no rest, echoing around these walls, fighting to create a song. I don't wanna miss a beat. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go. till I get up. Time is barely on our side. I don't wanna waste what's left. The storms we chase are leading us, and love is all we'll ever trust. Yeah, no, I don't wanna waste what's left. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go.
I know we didn't practice that, but. Stop looking at it, 'cause it's picking me off. No, the notes just a bit. Yeah, just the way it comes up on the screen. Gotcha. Yeah, they don't have. I think they don't have the notes.
Hello, everyone. Good afternoon. Hi. We are so super excited to be here today to talk with you about CCDF DISC. My name is Raymond Phillips. I go by Ray. Unless I am in trouble with you all, then it is Raymond. We want to just say welcome and thank you for being with us today as we introduce CCDF Data and Information System Consultation Center, also known as DISC. I am a strategy consultant supporting the work of DISC, and we are super excited to have this opportunity to share some information about our center and answer any questions that you may have. During this presentation, we will provide an overview of CCDF DISC, share the objectives of our center, the technical assistance our center provides, and dedicate some time to questions about DISC, and lastly, discuss next steps. Today, you will hear from my colleagues, Partha Mahapatra, technology consultant with DISC, and Meredith Russell, a child care consultant. Partha will cover information about CCDF IT environment scan. Meredith will discuss DISC's technical assistance, and I will cover DISC's intensive consultation. Now, before we jump into today's discussion, we want to share a little bit more information about our center. The Data and Information System Consultation Center is here to support CCDF lead agencies in your information technology efforts that will drive better user experiences, increase access to childcare, and achieve more equitable outcomes for children's families and providers. There are many aspects to achieving these goals, and IT systems live at the center of those efforts. DISC was created by OCC to fill a void and to be a resource for lead agencies as they upgrade, modify, and enhance their CCDF and IT systems. Now, we understand the importance of enhancing IT systems while administering the CCDF program and how it can support your efforts in maintaining compliance with the CCDF 2024 final rule, which ultimately also enhances outcomes for children, families, and providers. This is especially true now with the recent changes to the rule. Now, DISC aligns and expands on some of the ACF strategic plan goals, such as number 1, advancing equity, number 2, taking a proactive approach to ensuring that data can help support a continuous quality improvement process, and 3, high quality programming for families and enable and promote innovation within ACF by facilitating the development of new and innovative uses of technology. We are the newest center within the Child Care Technical Assistance Network, better known as CCTAN, and the DISC team includes staff with expertise in technology, child care, strategy, and project management to provide a well-rounded approach in serving lead agencies. DISC can be a valuable resource as you enhance efficiency within your business processes, and we are available to support your new or existing IT strategic plans. Core to our mission is to help lead agencies develop and implement IT strategic roadmaps to plan and envision what technology initiatives are needed, how to prioritize them, what technology best practices should be used, and how to plan for the execution and implementation of these technology programs and overall strategic roadmap. IT and data system improvements will benefit the families and providers served. DISC aims for technology to work for the needs of each individual lead agency for the long term so that any required enhancements or changes can happen with the proper amount of planning. Some of the specific objectives of DISC are to enhance family access, to obtain accurate, accessible, quality, and timely data, to improve and streamline online access, to systems, provide convenient and ease of access to the information, improve the time between applying for and accessing services, reduce the burden for providers to receive subsidy payments or licensing and professional development information, and overall improvement of the technology solutions to support key CCDF functions of the agency. DISC follows 4 key principles as we plan and deliver technical assistance. The first is human-centered design, which puts the end users, such as families and providers, at the center of any design or problem-solving process. This approach incorporates lived experiences to inform how processes are created, informed, and improved upon. Human-centered design makes resources or services easy to use, responsive, and aligned to the needs of providers, families, and children. For example, developing a consumer education website with parents' experiences and needs at the forefront that displays in an easy-to-understand, intuitive, and user-friendly manner for parents. Or using mobile technologies for CCDF application and eligibility in a way that streamlines the process for families. Now, equity is core to everything that we do, from how we serve lead agencies to the resources and services that we build. To know how we design and develop our toolkits and informational resources. DISC supports the flexibility of lead agencies and adapts and tailors technology solutions to family and provider needs, including accessibility and the use of assistive and adaptive technologies. DISC supports IT that will help promote parental knowledge, choice, and decision-making, and it recognizes the importance of providing families in an easy way to find and secure the support that they need, such as making resources available in multiple languages. DISC has an IT strategic framework to share with lead agencies as a foundation for our work. That framework includes 10 technology categories or domains in which we focus our technical assistance. These domain areas range from IT project management to IT procurement, IT data analytics, and IT user experience. Now, our fourth tenet may sound familiar. You have heard the term agile as it relates to technology, and really what this means is that we will be working in a manner that promotes collaboration, flexibility, and quickly responds to change. And as such, we will serve as an agile partner for you from how we approach intensive consultation to the recommendations we make on how to implement your systems, to how we prioritize and implement changes as needed when new requirements arise. When designing and developing data and IT systems in an agile approach, tasks are broken down into short phases of work. These short phases allow us to continuously collaborate with you and align to be sure that the tasks are meeting your goals. These 4 guiding principles apply to the resources and services we provide to the lead agencies. Now I will turn it over to Meredith, who will share about DISC technical assistance.
Thank you, Ray. Well, good afternoon, everybody. We are really excited to be here, and thank you so much for spending your time with us this afternoon. We're going to talk a little bit about what DISC is here to do to help you as lead agencies in your IT and data systems work. And I'll provide an overview of what services and resources DISC has, and then we'll dive into a little bit more detail over the next 45 minutes or so. So DISC provides a variety of resources and services to tribal, territory, and state CCDF lead agencies through technical assistance. And as Ray mentioned, one unique aspect of DISC is that we're focused specifically on the intersection of IT and childcare, particularly around CCDF. So that is our niche that we're looking forward to supporting you in. Our technical assistance falls into 3 categories. I'm sure these categories are very familiar to you: universal, targeted, and intensive TA. So the first category is our universal technical assistance. Universal technical assistance is designed to be available to you at your convenience. DISC's universal TA covers topics of broad interest across lead agencies, and it's created to raise awareness, increase knowledge, and provide tools or templates that advance recommended and effective practices. Some examples of what Universal TA looks like from DISC are our IT Resource Clearinghouse on our DISC website, which I'm going to dive a little bit deeper into here in just a minute, as well as our webinars, such as DISC IT Fundamentals series. If you're interested in following along at our website, you'll see that it's in your program, and also if you just look up DISC CCTAN, our website will come right up. The second type of TA that we provide is targeted technical assistance. And targeted technical assistance may involve DISC Center as well as other CCTAN centers that you're working with or that you may be planning to work with. Targeted TA is designed to focus more specifically on a particular topic and move from a foundational understanding of that topic into analysis or application of that topic in your work and your lead agency's work. So an example of targeted TA from DISC might be our peer-to-peer series that we call IT Matters, which hone in on specific topics, such as our upcoming one in September that will be around IT procurement. And so the third type of support that DISC provides is intensive consultation. And intensive consultation is that tailored or individualized TA. It's an opportunity for lead agencies to work one-on-one with DISC subject matter experts in IT systems, technology, data, childcare, and CCDF. DISC, as Ray mentioned, uses human-centered design, which centers families, providers, and lead agencies in the work. And DISC will work with lead agencies to develop and implement what we call an IT strategic roadmap that reflects your specific needs and goals around IT systems that you have that serve the children and families that you serve. Ray will be talking a bit more about intensive consultation in a little bit, and also you'll see that DISC will be providing webinars about our intensive consultation services upcoming this fall, so there'll be lots more information coming about our intensive consultation. One thing we want to mention that we'll be talking about quite a bit today, later in our presentation here, is that in order to make sure that DISC and our technical assistance is meeting your needs and meeting you where you're at as lead agencies, is we have created a CCDF IT environment scan. And what that scan is an IT self-assessment to identify what your needs are so that our TA is driving towards meeting those needs. So Partha will be talking quite a bit more about that shortly. But for now, let's dive a little bit deeper into the universal TA resources that we have available for all of you. So this is a picture of our web page. We host a web page on the CCTAN, or Child Care Technical Assistant Network website. So this may look familiar to many of you if you've used other CCTAN resources. And you'll see this is our landing page. Our webpage has 3 sections, and the first section is our IT Resources Clearinghouse, which contains IT and data system resources organized by those DISC 10 IT topic areas. So Ray was talking a little bit about an IT framework, and that has 10 specific content areas, and you'll hear us coming back to those 10 areas repeatedly as we share this presentation with you and as you work with DISC. So what you'll see on this IT Resource Clearinghouse is you'll see articles and tools that have been curated from CCTAN, from universities and other government entities. They're organized and gathered here for your convenience, again, according to those 10 IT topics. So let's say, for example, I am interested in finding resources around IT procurement. So I'd click on the IT sourcing and procurement topic here on the web page, and I see multiple relevant resources. Let's say I go ahead and click on the Child Care Administrator Information Technology and Procurement Guide, and voila, as they say, here is that particular resource, and this may look familiar to some of you. So you'll see this Resources Clearinghouse is a great place to start as you're looking for some foundational information about IT and data systems, and also just trying to get a better sense of what it is that DISC does. So again, here's this DISC IT framework and the 10 key topic areas. So here's a couple other examples of what you might find in the clearinghouse. Let's say your agency is looking for information about how to create a user-friendly consumer education website, or better engage the public through your social media. Those resources would be found under IT Communications Management. Under IT and data analytics, for example, there are several resources around data sharing or creating data visualizations to share with the public or your constituents. IT transformation houses some of those hot button issues that we're hearing a lot about, such as AI or cloud-based solutions. And then one final example, with data breaches always in the news, we know that cybersecurity is a really top concern and priority for all of you as agencies that manage public information. There's information under this topic under IT security and risk section about AI, so you can check that out as well. And with all of the work that we know is coming up and present for you with the 2024 CCDF final rule, we know that you're seeing opportunities to implement some IT changes in the work that you're doing. And so we want you to know that we will be continually taking a look at the resources that are on this page and updating them so that they can best meet your needs. So the second section of our web page covers our technical assistance and consultation opportunities. So what you'll see in this section is you'll see our TA calendar that shows some of those universal targeted and intensive consultation opportunities that we were just talking about. What you'll see in terms of what's coming is in August, we'll be very focused on providing you with information and support around the CCDF IT environment scan. And again, as Dr. Friedman mentioned this morning, it's something that we're really hoping all of you as lead agencies participate in. And we'll be talking a lot more about that shortly. So you'll be getting lots of information and support about that in August. And then you'll also see coming up in October, we'll be providing a lot of information about the intensive consultation services that we can provide to your lead agency. So more to come on that. And then the third section of our website is specifically dedicated to that CCDF IT environment scan, or that self-assessment. And at this time, I will turn it over to Partha, who will go into more detail about that.
Thank you, Meredith. And again, my name is Partha Mahapatra. I'm a technical subject matter expert with DISC. And as Meredith mentioned, I'm going to talk a little bit about what to expect from the CCDF IT environment scan. So let's talk a little bit about what an IT environment scan is in the tech world and how it can help agencies accomplish their goals. DISC understands how important it is to have effective data and IT systems that meet the needs of CCDF administrators, childcare providers, and most importantly, the families who are accessing quality and affordable childcare services. In order for organizations to enhance or improve their IT systems, the first step is to assess their systems and then create a baseline of where they are with their IT systems. So, for example, what we do is environmental scanning is one aspect. This is a process of self-assessing how your IT and data systems are working for the organization and your customers or your users that are on the system. The scan helps identify strengths and needs that help drive future decisions about your IT systems. Scans are also helpful in creating a baseline of the current functions. And that kind of gives us an idea of how your IT systems are performing as well. Scanning is used in a variety of industries and businesses and can focus on entire programs and all IT resources or on specific projects and activities. They can also focus on specific components of data and IT systems, like, for example, cybersecurity. Thirdly, scans can be used to determine the capabilities of data and IT systems in support of service delivery, program outcomes, and organizational mission. Scans can help identify specific areas or functions of IT systems that are not human-centered, need to be modernized in effect of the changes that are happening in IT, and those that are creating other pressure points for the organization or limiting the power and impact of data. Some other examples of environment scans include assessing how patient portals are used to coordinate healthcare, assessing readiness of cybersecurity systems to prevent attacks and data breaches, and identifying IT strategies and emerging trends to inform an organization's IT decisions. We'll look at the purpose of the CCDF IT environment scan now. So the overarching purpose of the scan is to illustrate how your data and IT systems are creating better user experiences, increasing access to childcare, and achieving more equitable outcomes, as Ray mentioned, for children, families, and providers. So we know that we are asking you to share your valuable time, your knowledge, your insights, and your experiences. And in some cases, we're going to ask you to collaborate with data and IT partners beyond your own team or your organization. So we want to express in clear terms what some of the benefits of completing the CCDF IT environment scan will provide. So completing the scan will be a useful exercise for lead agencies to critically assess how satisfied you are with your current functionality of your IT and data systems, and also help us understand how your IT and data systems are meeting expectations, your expectations, and/or your requirements. The scan results will benefit your program in other ways, like finding opportunities for collaboration with other lead agencies that may have valuable insights on effective technology uses in certain areas of CCDF administration, or having a meaningful conversation with your data and IT partners about their planned environments. It will also provide a way to benchmark your current IT environment across multiple categories, as Meredith was sharing, and see progress over time through annually updated scans. Information from those scans can be used by lead agencies to identify specific areas of your programs related to IT that may warrant additional investment and will help you to think through how data and IT systems can support the delivery of affordable, equitable, and highly quality childcare services. So results from the scan will add to the understanding of how data and IT systems are currently used in the delivery of equitable and high-quality childcare services. Information from the scan will also help DISC provide timely and relevant technical assistance based on what lead agencies' needs are so that we can best support improvement in these systems. Finally, with these initial baselines established, lead agencies can continue to tackle the following questions around IT changes. For example, how will you know what success looks like for your organization? How will you know when the process is complete? In what ways will you measure that the data and IT system upgrades incorporate human-centered design principles and improve the ways in which people interact with technology? What will you do if things don't go according to plan and you need to change course midway through the software development process that you are following? In order to have a fully defined and documented ideal end state or vision of success, we also need to understand our current or your current baseline as clearly as possible so that our change management and technology upgrade processes account for everything that is needed. This is what CCDF IT Environment Scan is intended to do. So let's look at the benefit of continue to look at the benefit of the environment scan in terms of how we can get better data and information systems and how it is critical to improving the experiences of families. So some immediate benefits of completing the CCDF IT environment scan include identifying specific strengths and needs of your current data and IT systems. Where you identify strengths, you may be able to determine how to scale them up and increase the impact of that data system, and where you identify needs, you can begin focusing on specific improvements or investments. So completing the scan also helps the Office of Child Care, OCC, ensure that the technical assistance provided is timely, relevant, and set measurable and attainable goals. So thinking about your priority goals for CCDF and incorporating the changes of this 2024 CCDF final rule or new rule can also provide some concrete examples for how the information collected in the scan can be used to identify areas for improvement. So when it comes to enrollment and eligibility, navigating enrollment processes can be burdensome for families, particularly if they are required to travel for in-person or paper applications rather than submit online applications. These processes can be specifically challenging for low-income families served by the CCDF program, in that families may not be able to take time off from work to make appointments or work irregular hours. Online applications in that case can ease administrative burdens on families, provide faster and more accurate initial responses, and overall improve the experience of families seeking childcare. Improving subsidy enrollment systems can also reduce burden and increase equitable access to childcare subsidies among eligible families. So childcare availability, many lead agencies are working diligently to provide searchable databases that have childcare providers that helps to identify available slots, locations, operating hours, monitoring reports, and credentials of staff and other material related to the licensure and operations of childcare centers. This provides relevant information to families and improves the customer experience while also supporting program integrity and maximizing available resources. The data sharing and coordination of care, in that aspect, there is a lot of exciting work happening in the data sharing and data integration spaces. The scan results will help to identify emerging themes across technology and policy for us and field for us as a field to better understand how lead agencies are maximizing available data to utilize new financial resources, expand the availability of childcare services, and lessen administrative burdens for families, providers, and lead agency and staff. So the scan is actually organized in two main sections, one section for general topics and another section that is focused on the childcare business functions. The general section is organized into broad topic areas with specific questions about the practices and methods used by the lead agency. You'll notice that these topic areas match the domain areas that Meredith was talking about, and that's available on the DISC IT Resources Clearinghouse webpage as well. As an example, we want to understand if the lead agency has a dedicated IT project management organization, whether full-time or part-time doesn't matter. But we also want to understand whether they outsource most of their data and IT systems work. And if they use best practices like agile and human-centered design to design and develop their IT systems. In the IT, data and analytics area, for example, we want to understand how the lead agency is leveraging key performance indicators, reports, and dashboards to highlight potential issues and drive decisions. We also want to understand data flows so we can reduce data duplication and improve data quality and sharing. So the second section of this scan, which is really the business functions section, this relates to data and IT systems that are used in the business. A business function really is a set of core activities that are necessary to administer the CCDF program. We've listed about 5 on the screen here that'll be included in the scan. We know that many or all of these processes require some level of technology and that the data systems for each of these functions could be integrated with one another or could be standing alone. For each of the business functions, we want to understand the level of automation you currently have and what improvements you're planning to incorporate. Lead agencies can rate the extent to which they have achieved an outcome or agree with a question. You can also rate the quality or satisfaction you have with the current implementation of these processes. For example, if an answer shows that a given function is not very automated but is deemed high quality, we may want to look at how a current high quality automation solution might be extended to include additional processes. Where there is a significant automation but low quality of satisfaction, we may want to help you think about how to modernize those IT systems so they provide greater value and effectiveness by aligning program design and operational policies and procedures within the IT environment itself. We also want to understand whether you have an existing IT roadmap for the improvements you want to make in these areas. An IT roadmap is often a visual or graphic of an organization's data and IT goals. Ray's going to go over that a little bit later. These roadmaps typically take the organization from where they are today to where they want to be in the future with their data and IT capabilities. The roadmap may also show the high-level phases necessary to accomplish those goals, including initiatives and timelines. An IT roadmap is more or less a living document that also serves as a communication tool and promotes transparency about where the organization is going. We'll talk more about that in a few. Where we find clusters of needs, typically where there is low automation, for example, and low satisfaction, we can target technical assistance, TA, to help achieve your outcomes, including compliance improvement. Lead agencies will be asked to consider the primary players or roles in each business function to ensure we address the needs of those partners. Our goal is that DISC TA helps lead agencies achieve effective and efficient operational and process improvements, adopt technologies that are affordable and sustainable, and that they optimally share data to improve quality and user experience. So there are also questions in the scan related to different aspects of the 2024 CCDF final rule and how certain changes may impact your data and IT systems. The scan will ask you to consider expected effort that may be required to modify existing IT systems and processes to fully implement the components of the final rule. The questions provide a good opportunity for lead agencies to assess the variety of ways the rule changes may affect different systems and consider specific needs or challenges you may face as you update or enhance these systems. The scan will help inform how DISC provides overall change management support as technology, program design, policies, regulations are changing simultaneously. So once DISC receives the scan results from CCDF lead agencies, we'll be working quickly to turn things around and provide individual copies of your scan responses back to you. And this will also include a summary level aggregate data that helps you better understand how the functionality, capabilities, and satisfaction of your own systems compares with other state and territory CCDF lead agencies by population, allocation, or by organizational structure and IT management capabilities, as determined by the scan results. So this is just one of the ways that we want to ensure that the participation in the scan helps you to better understand the data and IT landscape and your strengths and opportunities for improvement. You can use this to drive conversations and articulate existing pressure points in your data and IT systems with your IT partners and IT department leadership. Of course, the scan will help inform how DISC provides overall change management support as technology, program design, policies, and regulations are changing simultaneously, and you continue to think through how to implement the 2024 CCDF final rule. So the scan will be available online to allow for skipping and branching based on responses to questions. We understand that certain business functions may not be applicable to you, so if questions don't apply based on your answers, they will automatically be skipped to save you the time. The scan will be delivered using the ACF Qualtrics platform, which allows respondents to access the scan using a desktop, a laptop, or a mobile device, such as a tablet or a smartphone. The mobile view will be optimized for a smaller screen, such as your iPhone or Android. And that might appear slightly different from the desktop view. The respondent will be able to save their progress and move back and forth between devices, should they need to do that. We estimate that it will take approximately 45 to 60 minutes with a little bit of pre-work for each lead agency to complete the scan in Qualtrics. But depending upon the pre-work, it might take a little longer for you to gather that data during the pre-work and enter that into Qualtrics Online. We understand that different business functions and responsibilities may not exist in a single office, and the scan will permit collaboration across these offices. Multiple respondents will be able to complete different portions of the scan on their own as necessary, but we recommend that the scan be completed collaboratively by the CCDF program administrator or program specialist, along with some IT specialists in your organization. We want to make sure, and why we do that is we want to ensure that we get the best and most comprehensive information possible so that the scan results are a little bit more accurate. Please note that DISC will also be offering a more tailored version of the scan for tribal lead agencies that speaks to all of these topics, but may not be in the same format necessarily. Technical assistance such as webinars, office hours, instructions, and a glossary of terms will be made available to all lead agencies prior to and throughout the period during which the scan is open. More information on each of those events will be released in the coming weeks. So here you can see on the slide that's up there, you can see the difference in how the scan displays on a desktop compared to a smartphone. As more and more people access the internet and applications on the go, having the scan available in both desktop and mobile formats allows DISC to tailor the experience to the lead agency's needs. Next slide. So DISC will be available to support you while the scan is open. As I just mentioned, we will, following STAM, we will anticipate the scan to be released via the OCC listserv to all CCDF administrators on August 7th. We will be sending out survey links uniquely to each of your lead agency, and all responses will be confidential. We then have part 2 of our webinar on Tuesday, August 13th, during which DISC will provide a demonstration of the survey platform functionality, as well as preview reports that may be shared back with the lead agencies who complete the survey, and answer any questions about the scan that you may have. And this will be basically on the Qualtrics platform. During the period when the scan survey is open for responses, we have 3 open office hours scheduled on August 14th, 28th, and September 11th. These times are available to ask anything about the CCDF IT environment scan, such as Qualtrics functionality, engaging with IT partners, or providing responses to any of the questions as they relate to the data and IT systems business functions, or even the 2024 CCDF final rule. Lastly, as the scan closes on September 20th, DISC is available via email for any individual support that may be helpful to you. Next, Ray, you want a little bit more about intensive consultation, please?
Sure. But we realize that we have thrown a lot of information at you, especially as it relates to the CCDF IT environment scan. And so we want to take a moment to open up the floor to any questions that you all may have about that scan.
Questions are optional, but yeah, if you have any questions.
No. Is the scan optional?
Oh, the scan. Oh, sorry. See, that was a trick question, I guess. We prefer that you respond so that we can have a good baseline about your lead agency's IT data and systems. As Dr. Friedman mentioned, this is we're not saying it's mandatory, but it's essential for us to evaluate.
Yeah, and part of the reason for the scan too is to help make sure that we are providing the TA that is relevant to you. And so completion of the scan, we can see where there are commonalities or similarities, across lead agencies so that we can make sure that the technical assistance is relevant.
I had a question. What does the pre-work entail?
So as soon as the scan is available to you, you have a certain date by when you have to finish. Mm-hmm. So you can preview the questions in the scan. Sometimes you might have to go back to your IT specialist. Sometimes you might have to go back to your business areas to gather some information. So that's the pre-work you might have to do before you're ready to enter the answers into the survey. So you get an option with the office hours also. You get clarifications on how your responses would be relevant, or if you have any questions or doubts about the question itself, and what you need to kind of prepare. Okay. The office hours might help you kind of, help with that pre-work. to answer the questions. Okay.
Thank you.
You're welcome.
Yes, good afternoon. Can you speak to how it will work with the payment management piece? How the scan will work with the payment management. One of the pieces that you addressed was payment management and IT security.
Yeah, so in terms of payment management, the focus is on the data and IT systems. So if there are any data and IT systems in place that actually are managing payments today, and there's impacts, like for example, we would like to understand the maturity of that system, like what is that system currently doing? Do you have all the processes? Is it automated? So in that fashion, we'd like to understand, like, where is, technically, where does that system stand? So that's one aspect of it. But from a CCDF final rule standpoint, we'd also like to understand if there's an impact to that payment system, payment management system.
If there's an impact, will it speak to the areas that are needing an improvement?
So I would say that typically there's a strategic roadmap that has ways that you can actually apply improvement to the system. It's not going to be prescriptive. It's probably going to be more directional in sense of like what you could do if you're having a challenge, for example. But the idea is to get information so we can position some TA around that, whether it's universal or targeted TA, depending upon the need.
Okay, thank you.
You're welcome.
Josh Clement from Montana. I'm primarily a fiscal person, so that's where this lens of this question is coming from. So I understand the value of the scan, that if all 54 states and territories complete the scan, is this going to inform Dr. Friedman to actually leverage some funding? Because again, TA is great, but if we don't have dollars behind it, subsidy increased based on the new rules, so we're going to spend more money in subsidy, quality continues to grow, and what we just got done procuring, and unfortunately found out late that we could use ARPA funding, but at an $8.8 million adventure in COTS, that's a pretty heavy load that if we did not leverage ARPA at the time, we're doing the scan, you're going to come back and saying, yep, we're happy to help you, but if there's no leverage of fundings, other federal agencies have technical grants that we can apply. Will this scan help us get some of that technical funding so that we're not constantly fighting inside our own programs between subsidy and quality?
That's a good question.
Yeah, that's a really good question. I can't speak for OCC, but what I can say is that the data from the scan will help you provide some evidence about what is going on with your lead agencies that you can hopefully use to have those conversations. Additionally, when we look at the IT strategic roadmap, if you're a part of intensive consultation, that would also give you a very distinct plan that you can use to say, this is what we need to do in the time frame that we need to do it in. And that will help you identify, okay, where can you go, or have those conversations about where can you go to secure the funding.
Our CCD director does appreciate admiring the problems, but again, without the funding. So is there a spot in the scan for an assessment for directors to provide a shortfall of funding and what they would need, or by when, how many years they would actually need funding to meet full compliance to the new federal rules?
At this point in time, I do not think so. However, we can take that back to see how we can potentially incorporate the funding aspect of it.
Appreciate it.
There are some questions, though, that relate to the CCDF final rule. So there's some questions that allow you to provide, not objective answers, but more subjective text. And maybe that's an area where you can at least put some information that comes back and to inform.
The first webinar can be found on our website. It was a few weeks ago.
Yeah.
And so it's up on our website, available for you to view.
We can share the URL, after the call. Yeah.
So kind of a follow-up to Montana's question. I'm from Wyoming, so we're together in this. Is there any sort of focus from DISC where we could really start to leverage technology and modernization from other states where ARPA funding was used or the block grant was used, and then be able to apply that across states and do that in a pretty cohesive way so that Wyoming can help out Montana or vice versa?
That's a really good question. And so as a part of the scan, of course, we're trying to understand all of those landscapes. That way, as we continue to do things such as our target TA where we have peer-to-peer, we can have those conversations to see if that is an available path forward.
And also in response to that, some of the TA that we've done and that we're continuing to do are peer-to-peer events. Just exactly what Wyoming just said, knowing that there's a real eagerness and there's a real usefulness to learning what other lead agencies are doing. And so that's something we have planned. And also, as Dr. Friedman said this morning, we're a new center, and a huge part of our job right now and always, but particularly now, in our first year, is really listening and hearing from you folks. What do you need? What will be helpful? Where are the pain points? So everything that we hear in the scan, as well as everything we hear in venues like this and in our conversations with you and our other CCTAN partners, we are making notes, we are taking it back to the team, we are talking with our contract officers so that we can really be listening and responsive to what's helpful to you. So again, thank you for the questions and the comments. It's all really important for us to continue to build and build TA that's useful to you.
So that's something that we're looking at, how to share the information. So as we collect the information, there's a process behind the scenes where we can actually do a little bit of like where do different on different business functions or on specific data and IT related questions, where do different lead agencies stand? There's a way to get to that. We're still figuring that out. We haven't really gotten to that, but once we figure that out, we will, based on on how the sharing will happen, it will be made available. But I don't think we have a mechanism of that defined yet.
So just to follow up on that, on Wyoming and Montana and New York, we're just right next to each other. No. I think part of what would be helpful in the scan, and if it was made public, is also cross-referencing it with the CCDF plan if those examples are compliant. And so I think one of the things we always ask about is like, can you show me an example of a peer-to-peer, but also that it's a compliant peer-to-peer, right, with inspection reports or with whatever, because I think we talk to each other, but we never know that it's like, this is a good example of posting inspection reports. These are full inspection reports, right? And knowing that those have received, sign off as fully compliant. So that would be helpful. And when we submit all of our information, if there was some way to cross-reference, maybe with the regional offices, that like New York system is perfect, of course. And completely
and your name
compliant.
Was again?
That's right, completely compliant with all, and then, knowing that we could share that system with Wyoming if they said, hey, what do you use for inspection reports? And then I can show that.
That's really well said, and that's something we've been talking about a lot. We want to share really effective practices and really promising practices, and we're not involved on the monitoring side and compliance with CCDF plans at all, but we will work closely with other partners to help develop, that sort of repertoire of what's really working and what's working with the requirements around implementation. So thank you, New York. Great point.
And some of that, just a tag onto that, we're also looking at the IT strategic roadmap, and any kind of best practices we do see, it'll be incorporated in the strategic roadmap. That is also a kind of a living document, if you will. Now, basically when we have the regional meetings and stuff, we do share amongst states where things are happening, in a better shape or fashion. And some of that we're internally discussing how we can make that part of universal TA as well.
Okay. I will now get into intensive consultation. Thank you so much for your questions. And thank you, Partha, for walking us through the CCDF IT environment scan. Now, intensive consultation, as Meredith mentioned, is DISC's individualized TA, and it looks to make a large-scale and long-term impact on how technology is used to implement the CCDF program, and to make sure that the CCDF program operates in the best way possible for lead agencies and their constituents. Now, we understand the opportunities lead agencies are facing with updating, enhancing, or rolling out new systems, and intensive consultation provides an opportunity to work one-on-one with us and our team of subject matter experts in IT, childcare, as well as strategy, on the best ways to incorporate iterative human-centered design techniques to develop and implement IT strategic roadmaps that really reflect your unique data and IT needs and improves the experiences for families and children. Now, intensive consultation is a relationship-based service where DISC will work with the lead agencies to achieve their IT and data system goals. And these goals, in the end, create better access, outcomes, and user experiences for families and providers. Now, intensive consultation will be delivered in 2 key phases. The first phase is the IT strategic roadmap development. During this phase, CCDF lead agencies will work with a dedicated team of DISC subject matter experts and consultants for approximately 6 to 9 months to develop an IT strategic roadmap related to improving, enhancing, and/or building out IT and data systems to meet the specific needs of lead agencies, families, and providers. Now, that second phase is the IT strategic roadmap implementation. And during this phase, DISC will work with select lead agencies and will continue working with them to provide ongoing support and consultation services at no cost to lead agencies for up to an additional 24 months as they take actions to implement priority aspects of their IT strategic roadmap. The request or application for intensive consultation will be available this fall, and collaboration between DISC and the selected lead agencies is expected to begin in January of 2025 to develop the IT strategic roadmaps. Approximately 25 lead agencies will be selected for development consultation, and up to 10 lead agencies at a time will receive implementation consultation. Now, you may be asking, what is an IT strategic roadmap? An IT strategic roadmap is a document that, 1, details key goals for implementing improved IT and data systems, 2, outlines the initiatives and steps necessary to achieve those goals, 3, defines the timelines in which those initiatives need to be completed to move toward the goal, and 4, identifies the dependencies, and potential obstacles for implementing improved IT systems that meet CCDF requirements. Roadmaps are developed to give leaders an overarching plan and strategies for designing new IT and data systems, upgrading existing IT and data systems, and identifying in which technologies are best suited to meet the lead agency's needs. An IT strategic roadmap helps to get you where you are from where, IT strategic roadmaps helps get you from where you are to where you would like to be. Because without a roadmap, many people will get lost along the way and end up taking a route that may not get them to their end goal as quickly. I think we've heard from some of our regional meetings about implementing a system that by the time it was implemented, it really didn't solve or address the needs that you all had. And so with this IT strategic roadmap, we're hoping to provide a high-level view and a plan for you to be able to execute so that everything can be in lockstep and you do receive the product, the technology that you need to meet your needs. IT strategic roadmap development will follow these 5 steps over the course of 6 to 9 months. Frequent collaboration will occur between DISC and the selected lead agencies during each step. The first is engaging key players and document current state. This means that we'll be identifying key roles and meeting with key staff to set expectations and understand the current state of the lead agency's CCDF systems. And with that, we'll be taking a look at state plans, we'll be taking a look at the results from the IT environment scan, and additional data sources to make sure that we can understand what your unique challenges are so that we have a proper way or a unique or tailored strategic plan for you to execute on. Now, the second step or phase is documenting that future state. And so we will determine the future state goals and rank those goals to aid in decision making, then benchmark those goals to estimate potential outcomes and measure performance. The third is identifying gaps and opportunities, and this is where we're going to analyze the IT and data systems impacting the business needs, or those functional areas that Partha mentioned, and really try to find what the strengths and weaknesses are, as well as identify discrepancies such as business process reengineering or infrastructure upgrades, organizational alignment, hiring, etc. And then identifying the IT strategic roadmap initiatives. This is where we're going to rank those gaps based on the impact to lead agencies' goals, identify the projects to fill those gaps, assess resources, estimate costs and timeframes, and sequence projects based on the dependencies. So as the question that we received earlier about the finances and how to obtain those funds, this document will help you clearly state what you need and the funding you need for it to help acquire those funds. And then lastly, documenting the IT strategic roadmap, which we will draft the roadmap to present to key staff for feedback, solicitation, and incorporate any changes before publishing a final IT strategic roadmap with the lead agencies. Now, looking at that second phase of intensive consultation, once the IT strategic roadmaps have been completed, DISC will continue to provide ongoing support for up to 10 lead agencies at a time as they begin implementing those priority areas. We will act as a partner throughout various activities to help lead agencies manage aspects of their roadmap implementation and ensure that any changes made to their CCDF data and IT systems will provide lasting and long-term benefits to children, families, and providers. In this second phase of intensive consultation, the DISC team of consultants and collaborators will work side by side with lead agencies as they begin their work implementing the strategic roadmap. That implementation period will require regular collaboration between the DISC team and the lead agencies to create individualized work plans. Now, these collaborations may occur through a virtual meeting or potential on-site visits, and the frequency and number of those meetings will be determined through the IT strategic roadmap and initial conversations with each selected lead agency to tailor the type of support required to achieve the desired outcomes. Now, implementation will look different for each selected agency, but will follow a standard set of steps. Key staff will need to be involved to review expectations and document project goals, scope, timeline, and budgetary considerations. Specific planning will then need to take place to define activities, assignment, and due dates for deliverables. And the last step would be the delivery of any work products and perform analysis to ensure it has met the expected outcomes. More details about intensive consultation, the processes around it, and further explanation of the key concepts will be explored in future DISC TA events, and we look forward to hearing from you throughout the next several months to understand more about how we can support you with any IT system initiatives, and are excited to begin working directly with you. So you might be thinking, What does that second phase of intensive consultation look like? DISC can be a partner in determining the best types of system modifications or changes that might need to be made in your specific program to support the 2024 CCDF final rule. We know many lead agencies will need some system changes to make enrollment-based eligibility and payments a reality, and DISC is here to support the necessary IT enhancements. We can also help design projects to improve access to quality data so that data dashboards can be created to enable data-driven decision-making. And maybe your goal is to improve your online presence to be more user-friendly in providing data and information to families and providers. The goal for the lead agencies is to utilize modern technology solutions that are flexible and can easily be modified to incorporate future changes as needed. And just for clarification, there are a few services DISC will not be able to provide. We will not be able to participate in source selection of IT services, the direct hiring of staff, participate in intensive consultation. Let's first begin with the first phase, the IT strategic roadmap development. All state, territory, and tribal lead agencies are eligible and encouraged to request intensive consultation. There will be a short form where you will answer these questions related to your data and IT system goals, and lead agencies will need to meet some prerequisites to participate, including identifying an executive leadership champion that has authority to dedicate appropriate staff and resources to the project, and identifying outside entities such as government agencies or nonprofits involved in the administration of CCDF that may need to be involved. DISC will review all application responses, consider several data sources that provide additional information on each lead agency, and make recommendations to OCC, who will make all final selections. Considerations will be based on the impact of the request, equity for tribes and territories to ensure those interested will be able to participate, distribution across multiple regions, review of improper payment report, 2024 CCDF final rule impacts, CCDF compliance, resource allocation, and other priorities identified by OCC. Initial contact between DISC and the selected lead agencies will occur following OCC's written notification of selection to introduce the teams and sign TA agreements. At the conclusion of the IT strategic roadmap development efforts, the lead agencies involved will have the opportunity to apply for ongoing consultation and support services from DISC to achieve priority aspects of the plan over an agreed upon consultation period up to 24 months. The application will allow DISC to evaluate the lead agency's ability to implement and complete initiatives within the IT strategic roadmap in agreed upon timeframes. This application will ask for specific details about staffing and resources needed to accomplish the priority portions of your IT strategic roadmap and roadblocks or risks that may hinder the work. Lead agencies will be asked to describe how projects align with key OCC priorities. Now, DISC will review applications and evaluate the scope of the project, readiness of the lead agency, and potential impact of the project to recommend up to 10 lead agencies at a time who will be provided ongoing consultation. OCC will determine and notify the participating lead agencies. Now, I know I've shared a lot of information with you around our intensive consultation, and at this time, I want to make sure that I open the floor up to any questions you may have around intensive consultation. All right, we will continue. Over the next few months, DISC will have technical assistance events for the CCDF IT environment scan, which Partha kind of alluded to earlier in the presentation. We will have peer learning sessions and of course, intensive consultation. In the CCDF IT environment scan, related events Lead agencies will have the opportunity to learn about the purpose, goals, benefits, and outcomes of the CCDF IT environmental scan and receive further information and instructions on completing the scan. Additional resources such as our open office hours for questions and answers, web page posts, and other materials will be provided alongside these webinars to share additional information. DISC will also continue its peer learning sessions, IT Matters, in which the topic of the session is IT procurement. Lead agencies will have the opportunity to cooperatively discuss with each other effective practices and technology innovations for CCDF program administration. And lastly, in this fall, DISC will host a webinar on intensive consultation, opportunities for lead agencies, which is our individualized TA. Additional resources will be provided, including information on how to request intensive consultation, frequently asked questions, and schedules for open office hours. Please keep an eye out for communication in the coming months. And at this time, I will open it up again for questions. Is there anything lingering on your mind from our technical assistance, our IT environment scan, or our intensive consultation? We are happy to answer them.
While you're thinking about questions, there is one clarification that we want to give about the IT environment scan. I know you had a question around, how we'll share the data. So one of the things that comes out of the scan for the lead agencies is an individualized report. You will see an individualized report. So I just want to make sure that, everybody understands that. And then we're looking at, ways to, share, some practices that we gathered through that. And that individualized report will definitely help you in your modernization path, or if you're trying to compare it back to the IT strategic roadmap, if you're down that road, it's certainly going to help you with that. So there's, definitely some feedback you'll be getting from the scan.
Yes.
Hi, Erica Kelly. I'm one of the CCTAN partners from National Center on Early Childhood Quality Assurance. Try saying that 5 times fast. But I'm super excited about the IT scan that you're doing. And when you get the results back, will you be able to share it with the partnering national centers? Because I imagine there might be just some areas that your partnering centers that we have expertise in, and so would you be able to just kind of leverage our, SME background to be able to support the states, tribes, and territories as well?
Yes, part of our targeted technical assistance, yes, is making sure that if there is a topic or a request that comes through in which it requires partnership with other CCTAN centers, we will definitely have the data from the scan to help us better understand the lead agencies that you're working with. That way we can make sure that the advice or the response to that request is the most accurate thing that we can deliver. One of the things that we've been hammering home is that whole human-centered design approach. We think it's super important for us to be impactful in the work, to affect the changes that we want, to make sure that it is extremely relevant. And so having the data and being able to facilitate the conversations and the partnership with you allows us to be better informed and allows us to provide better TA to ultimately have the outcomes and the impact that we want.
That's fantastic. And one last question. So one of the projects that I work with is our mental health subject matter expert work group. And Ruth talked about earlier how we're doing a lot of targeted and universal technical assistance around our mental health strategies and action. Would there be opportunities for us to work, again, with your center so that we can collect information on the impact that our center and OCC's initiatives are having on our states, tribes, and territories?
Can I? Yeah. I'm really glad you asked that. So my colleague Crystal Robinson over here, I believe, sits on that work group. Oh, hey! And literally, just as we were getting ready to fly out on Friday, we're having conversations about what that intersection is between technology and data systems and the mental health work that's going on with lead agencies, and some of which I think we saw a little bit of this morning as well. So we would love to talk more and figure out what those intersections are and how we can help. So.
All right, sounds good. Thanks.
Yes, very timely. Thank you.
Yeah, that was a good question, because sometimes when we have an initial scan, we might not have covered all the topics, and that's why we look at an annual update to the scan as well. So keep in mind that if there's certain topics that haven't been addressed, it will be taken into consideration for the next iteration of the scan.
Any other questions? Yes, no, maybe so. Okay. Well, if you are interested in learning more about DISC or want to engage with us, you're welcome to reach out to us via email or access our information on the DISC website. We are happy to stick with the QR code theme, and we have added the QR code to our website. And so please reach out if you have any questions, and if you're interested in receiving technical assistance, please connect with your OCC Regional Program Manager or State System Specialist. We truly appreciate our time with you this afternoon, and we'll be here in the room if there are any questions you would like to ask us about privately. Thank you so much for your time, and I hope you enjoy the rest of the STAM conference.
Thank you, everyone.
inside that I can't ignore. Oh, I feel it tonight. That look in your eyes got me begging for more. Oh, I feel it tonight. There's something inside that I can't ignore. Oh, I feel it tonight. That look in your eyes got me begging for more. The storms we chase are leading us, and love is all we'll ever trust. Yeah, no, I don't wanna waste what's left. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go. Finding life along the way, melodies we haven't played. No, I don't want no rest. Echoing around these walls, fighting to create a song. I don't wanna miss a beat. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go. And we'll grow in number, fueled by them to see the horizon, turn us to thousands. And we'll grow in number, fueled by them to see the horizon, turn us to thousands. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go.
5 minutes.
Never mind. I'm gonna skip it. Skip it. Thinking out loud.
Hello. How is everyone doing this afternoon? Great? Great. I think we're the last session before we finish up for the day. I'm sorry to be the roadblock for you all. Hello, hello, welcome and welcome. Thank you so much for joining us this afternoon for the introduction of CCDF Data and Information System Consultation Center, also known as DISC. My name is Raymond Ray Phillips, so that means if you're calling me Raymond, I am in trouble with you, and you have full permission to do so. I am a strategy consultant that supports the work of DISC, and we are extremely excited to share some information about our center and answer any questions that you may have. Now, during this presentation, we will provide an overview of the CCDF Data and Information System Consultation Center, also known as DISC, share the objectives of our center, the technical assistance our center provides, dedicate some time to some questions and answers about DISC, and lastly, discuss the next steps. Today, you will meet and hear from my colleagues, Partha Mahapatra, a technology consultant within DISC, as well as Meredith Russell, a childcare consultant here with DISC, and they serve as subject matter experts in their respective fields on the project. Partha will cover information about CCDF IT environment scan. Meredith will discuss DISC's technical assistance, and I will cover DISC's intensive consultation. Now, before we jump into today's discussion, we want to share some information about our center. The DISC Center, or Data and Information System Consultation Center, is here to support all CCDF lead agencies in your information technology efforts that will drive better user experiences, increase access to childcare, and achieve more equitable outcomes for children, families, and providers. There are many aspects to achieving these goals, and IT systems live at the center of those efforts. DISC was created by OCC to be a resource to lead agencies as they upgrade, modify, or enhance their CCDF data and IT systems. Now, we understand the importance of enhancing IT systems while administering the CCDF program and how it can support your efforts of maintaining compliance with the 2024 CCDF final rule, which ultimately also enhances outcomes for children, families, and providers. DISC aligns and expands on some of ACF's strategic plan goals, such as number 1, advancing equity, number 2, taking a proactive approach to ensuring that data can help support a continuous quality improvement process, 3, high quality programming for families and enable and promote innovation within ACF by facilitating the development of new and innovative uses of technology. And with us being the new center within the Child Care Technical Assistance Network, or better known as CCTAN, the DISC team includes staff with experiences in technology, child care, and strategy, and project management to provide a well-rounded approach in serving lead agencies. DISC can be a valuable resource, and core to our mission is to help lead agencies develop and implement IT strategic roadmaps to plan and envision what technology initiatives are needed, how to prioritize them, what technology best practices should be, and how to plan for the execution and implementation of these technology programs and overall strategic roadmap. IT and data system improvements will benefit the families and providers served. DISC aims for technology to work for the needs of each individual lead agency for the long term so that any required enhancements or changes can happen with the proper amount of planning. Some of these specific objectives of DISC are to enhance family access to accurate and timely information about providers, to improve and streamline the online application and renewal experiences for families, to reduce the burden for providers to receive subsidy payments or licensing and professional development information, and overall improvement of the technology solutions that support key CCDF functions of the agency. DISC follows 4 key principles as we plan and deliver technical assistance. The first is human-centered design, which puts the end users, such as families and providers, at the center of any design or problem-solving process. This process incorporates lived experiences to inform how processes are created and improved. Human-centered design makes resources or services easy to use, responsive, and aligned to meet the needs of providers, families, and children. The second is equity, and it's core to everything that we do, from how we serve lead agencies to the resources and services that we build. DISC supports the flexibility of lead agencies to have choice and adapt and tailor technology solutions to family and provider needs, including accessibility to the use of assistive and adaptive technologies. Third, DISC has an IT strategic framework to share with lead agencies as a foundation for our work. The framework includes 10 technology categories or domains in which we focus our technical assistance. These domain areas range from IT project management to IT procurement, IT data and analytics, and IT user experience. Now, a fourth tenet may sound very familiar to you, and you may have heard the term agile as it relates to technology. And really what this means is that we will work in a manner that provides and promotes collaboration, flexibility, and quickly responding to change. As such, we will serve as an agile partner for you from how we approach intensive consultation to the recommendations we make on how to implement your systems. And the purpose of this is so that we can prioritize and implement changes as the need arises when new requirements are released. These 4 guiding principles apply to the resources and services we provide to lead agencies. And now we'll turn it over to my colleague Meredith, who will share about DISC technical assistance.
Thank you, Ray, and good afternoon, everyone. We're very excited to be here to share with you about what DISC can do to support you as a lead agency. So thank you for spending this time with us. So let's talk a little bit about what DISC is here to help you as lead agencies with and how we can collaborate with you on your technology and IT data systems work. I will provide an overview of our TA services, and then we'll go into more detail in the next 45 minutes or so. So DISC provides a variety of services and supports to tribal, territory, and state lead agencies through technical assistance. And as Ray mentioned, one unique aspect about DISC is that we are focused on the intersection of technology and childcare, specifically CCDF. Our technical assistance falls into 3 categories: universal, targeted, and intensive, and these categories likely sound very familiar to you. The first category is universal technical assistance, and universal technical assistance is designed to be available to you at your convenience. Universal technical assistance covers broad topics of broad interest to many lead agencies, and it's created to raise awareness, increase knowledge, and provide tools and templates for you to use that advance recommended and effective practices. Examples of DISC universal technical assistance include our webinars, such as our IT fundamentals, and also our website, which we're going to go over in a bit more detail in just a few minutes. And if you're interested in finding our website, if you just look up DISC CCTAN, it should come right up for you. You also have the link in your program. The second type of technical assistance that we provide is targeted technical assistance. And targeted TA may involve DISC Center as well as some of the other CCTAN centers that you may be working on or be planning to work on. So that work, targeted TA, looks like collaboration with DISC, another center, and a lead agency. So targeted technical assistance is designed to focus on a more specific topic and move from a foundational understanding to an analysis and application of that topic or concept in your work. An example of DISC targeted TA includes our peer-to-peer learning sessions, which we call IT Matters, which hone in on a specific topic such as procurement. And we do have an IT Matters session about procurement coming up in September. And the third category of TA technical or DISC technical assistance is intensive consultation. An intensive consultation is tailored or individualized TA, and it's an opportunity for lead agencies to work one-on-one with DISC subject matter experts in IT systems, technology, data, childcare, and CCDF. As Ray mentioned, DISC uses human-centered design, which centers families, providers, and lead agencies. DISC will work with you to develop and implement an IT strategic roadmap that reflects your unique IT and data needs and goals to improve experiences for the families and children that you serve. Ray will be talking in more detail today about DISC intensive consultation in just a few minutes, and we will also be providing some webinars about intensive consultation this fall, so much more coming on that topic. In order to ensure that DISC technical assistance meets your needs and meets lead agencies where they are, we have created a CCDF IT environment scan. The scan is an IT self-assessment to identify the needs of your lead agencies, and you heard Dr. Friedman talk about the IT scan this morning, and Partha will be going into more detail about that shortly. But first, let's go back and look more at some of the universal TA resources available to all of you. So, DISC hosts a web page on the CCTAN, or Child Care Technical Assistant Network website. So this may look familiar to you if you've used other CCTAN Center resources. And here you'll see a video of the landing page for DISC. So the DISC web page has 3 sections. The first section is the IT Resources Clearinghouse, which contains IT and data system resources organized by DISC's 10 IT topic areas. You'll see articles and tools that are curated from CCTAN, universities, and other government entities, and they're gathered and organized here for you in one place. So just as an example, if I click on the CCDF IT Resources Clearinghouse page, and I see the headers for those 10 IT domains or categories, and there's articles and links and toolkits under each category. And let's say I want to find resources about IT procurement. So I click on the IT sourcing and procurement link there, and I'd see multiple relevant resources. And if I click on the Child Care Administrator's IT and Procurement Guide, you'll see that it links me to this specific tool. And this tool may look familiar to you, but that's just an example if you see how these curated resources are organized and available to you at your convenience. This clearinghouse page is a great place for you to get started if you're looking for some foundational information on IT or data systems, and also just to kind of see what DISC offers and what our scope of work is in supporting you. So again, these are DISC's 10 IT topic areas. This is how our clearinghouse is organized. This is how the IT scan is organized. So you'll be seeing this come up more and more as we tell you a little bit about what DISC's work is. A couple other examples of some resources that fall under these categories. Let's say your agency is looking for information about how to create a user-friendly consumer education website, or how to better engage your public through social media. Those resources could be found under IT communication management. Under IT data and analytics, for example, there's information related to data sharing and how to create data visualizations to share data with your public. The IT transformation section houses information on some hot button topics such as AI and cloud-based solutions. And speaking of AI, with data breaches always in the news, cybersecurity is a top priority for any agency managing public information. There's information on this topic under the IT security and risk section. And just so that you're aware, with all of the work that folks are doing on the 2024 CCDF final rule and some of the considerations you may be making about what opportunities that brings up for changes within your IT and data systems, DISC will continue to update this resource page so that it's of best use to you and relevant to the things that you're working on. So we'll continue to update this as time goes by. The second DISC webpage section covers our technical assistance and consultation opportunities. For example, you'll see our TA calendar in this section that shows some of these universal, targeted, and intensive consultation events, such as the ones we've been talking about. You'll see our focus coming up in August will be focused on providing you with information and support around that CCDF IT environment scan, which is the self-assessment. And then this fall and in October, we'll be focused on providing you with information about how you can apply for DISC's intensive consultation. And we'll be sharing more about these TA events later in the session. And then our final and third section of our website is devoted to the CCDF IT environment scan. And at this time, I will turn to Partha, who will talk in more detail about the scan.
Thank you, Meredith. Hi, my name is Partha Mahapatra. I'm a technical subject matter expert at DISC, and I would like to talk to you about 15-20 minutes on what to expect from the CCDF IT environment scan. So let's talk a little bit more about what this IT environment scan is, what does it mean in the tech world, and how it can help agencies accomplish their goals. DISC understands how important it is to have effective data and IT systems that meet the needs of CCDF administrators, childcare providers, and most importantly, the families who are accessing quality and affordable childcare services. In order for organizations to enhance or improve their IT systems, the first step is to assess their systems and create a baseline of where they are with their IT. The scan helps identify such things and the strengths and needs that can drive future decisions about your IT systems. Scanning is used in a variety of industries and businesses and can focus on entire programs and all IT resources or on specific projects and activities. They can also focus on specific components of data and IT systems like cybersecurity, for example. Scans can be used to determine the capabilities of data and IT systems in support of service delivery, program outcomes, and organizational mission. Scans can help identify specific areas or functions of IT systems that are not human-centered, need to be modernized, or are creating other pressure points for the organization or limiting the power and impact of data. So coming to the purpose of the CCDF IT environment scan. The overarching purpose of the scan is to illustrate how your data and IT systems are creating better user experiences, increasing access to childcare, and achieving more equitable outcomes for children, families, and providers. We know that we are asking you to share your valuable time, your knowledge, insights, and experiences in some cases to collaborate with data and IT partners beyond your own team or organizations. So we want to express in clear terms what some of the benefits of completing the CCDF IT environment scan will provide. Completing the scan will be a useful exercise for lead agencies to critically assess how satisfied you are with current functionality of your IT systems and development practices, and whether your IT and data systems are meeting expectations or requirements. The scan results will benefit your programs in other ways, like finding opportunities for collaboration with other lead agencies that may have valuable insights on effective technology uses in certain areas of CCDF administration, or having a meaningful conversation with your data and IT partners about planned improvements. It will also provide a way to benchmark your current IT environment across multiple categories and see progress over time through annually updated scans. Information from the scan can be used by lead agencies to identify specific areas of your programs related to IT that may warrant additional investment and will help you to think through how data and IT systems can support the delivery of affordable, equitable, and high-quality childcare services. Results from the scan will add to the understanding of how data and IT systems are currently used in the delivery of equitable and high-quality childcare services. Information from the scan will also help DISC provide timely and relevant TA based on what lead agencies' needs are, so that we can best support improvement in these systems. Finally, with these initial baselines that can be established, lead agencies can continue to tackle some questions around IT changes. For example, how will you know what success looks like? How will you know when the process is complete? In what ways will you measure that the data and IT system upgrades incorporate human-centered design principles and improve the ways in which people interact with technology? What will you do if things don't go according to plan and you need to change the course midway through the software development process? So, better data and information systems are critical to improving the experiences of families receiving childcare services and providers delivering these services. Some immediate benefits of completing the CCDF IT environment scan can include identifying specific strengths and needs of your current data and IT systems. Where you identify strengths, you may be able to determine how to scale them up and increase the impact of that data system. And where you identify needs, you can begin focusing on specific improvements or investments. Completing the scan also helps the Office of Childcare OCC ensure that the technical assistance provided is timely, relevant, and set measurable and attainable goals. So thinking about your priority goals for CCDF and incorporating the changes of the 2024 CCDF final rule can also provide some concrete examples for how the information collected in the scan can be used to identify areas for improvement. So for example, when it comes to enrollment and eligibility, navigating enrollment processes can be burdensome for some families, particularly if they are required to travel for in-person or paper applications rather than submit online applications. So these processes can be especially challenging for low-income families served by the CCDF program. In the families may not be able to take time off from work to make appointments or work irregular hours. Online applications can ease administrative burdens on families, provide faster and more accurate initial responses, and overall improve the experience of families seeking childcare. Improving subsidy enrollment systems can reduce burden and increasing equitable access to childcare subsidies among eligible families. Another example is data sharing and coordination of care. There is a lot of exciting work happening in the data sharing and data integration space. The scan results will help to identify emerging themes across technology and policy for us as a field to better understand how lead agencies are maximizing available data to utilize new financial resources, expand the availability of childcare services, and lessen administrative burdens for families, providers, and lead agency staff. The scan is organized into two main sections. One section for general topics, and another section that is focused on the childcare business functions. The general section is organized into broad topic areas like Meredith mentioned, the domain areas. And there will be specific questions about the practices and methods used by the lead agency in those areas. You'll notice that these topic areas match the 10 or 11 domain areas on the website, as Meredith has already talked about. As an example, we want to understand if the lead agency has a dedicated IT project management organization, whether it's full-time or part-time, whether they outsource most of their data and IT systems work, and if they use best practices like agile and human-centered design to design and develop their IT systems. In the IT and data analytics area, for example, we want to understand how the lead agency is leveraging key performance indicators, reports, and dashboards to highlight potential issues and drive decisions. We also want to understand particular data flows that you may have so we can reduce data duplication and improve data quality and sharing. The second section of the scan, which is the key business functions, this will help lead agencies to self-assess their business functions as they relate to data and IT systems. A business function is really a set of core activities necessary to administer the CCDF program. We've listed 5 such business functions here that will be included in the scan. We know that many of all these processes require some level of technology, and that the data systems for each of these functions could be integrated with one another or could stand alone. For each of the business functions, we want to understand the level of automation you currently have and what improvements you are planning. Lead agencies can rate the extent to which they have achieved an outcome or agree with a question. You can also rate the quality or satisfaction you have with the current implementation of these processes. For example, if an answer shows that a given function is not very automated, but it is deemed high quality, we may want to look at how a current high quality automation solution might be extended to include additional processes. Where there is significant automation, but low quality of satisfaction, for example, we may want to help you think about how to modernize those IT systems so they provide greater value and effectiveness by aligning program design and operational policies and procedures within the IT environment. We also want to understand whether you have an existing IT roadmap for the improvements you want to make in the areas. An IT roadmap is often a visual or graphic of an organization's data and IT goals. Ray will be going through some of that, IT strategic roadmap details shortly. And we'll be talking more about the IT roadmaps and how it's used. Where we find cluster of needs, typically where there is low automation and low satisfaction, we can target TA to help achieve your outcomes, including compliance improvement. Lead agencies will be asked to consider the primary players or roles in each business function to ensure we address the needs of those partners. Our goal is that DISC TA helps lead agencies achieve effective and efficient operational and process improvements. At the same time, allow them to adopt technologies that are affordable and sustainable, and that they optimally share data to improve quality and user experience. So there are also questions in the scan you will find that are related to different aspects of the 2024 CCDF final rule and how certain changes may impact your data and IT systems. The scan will ask you to consider expected effort that may be required to modify existing IT systems and processes to fully implement the components of the final rule. The questions provide a good opportunity for lead agencies to assess the variety of ways the rule changes may affect different systems and consider specific needs or challenges you may face as you update or enhance these systems. The scan will help inform how DISC provides overall change management support as technology program design, policies, and regulations are changing simultaneously. Once DISC receives the scan results from CCDF, lead agencies will be working quickly to turn things around and provide individual copies of your scan responses back to you, as well as summary level aggregate data that helps you better understand how the functionality, capabilities, and satisfaction of your own system compares with other state and territory CCDF lead agencies by population, allocation, or by organizational structure and IT management capabilities as determined by the scan results. This is just one of the ways that we want to ensure that the participation in the scan helps you to better understand the data and IT landscape and your strengths and opportunities for improvement. You can use this to drive conversation and articulate existing pressure points in your data and IT systems with your IT partners and IT department leadership. Of course, the scan will help inform how DISC provides overall change management support as technology program design, policies, and regulations are changing simultaneously, and you continue to think through how to implement the 2024 CCDF final rule. So the scan will be available online and will allow for skipping and branching based on responses to questions you provide. We understand that certain business functions may not be applicable. So if questions do not apply to you based on your answers, they will be automatically skipped to save you the time. The scan is going to be administered by ACF Qualtrics platform, which allows respondents to access the scan using a desktop, laptop, or any mobile devices such as a smartphone or a tablet. The mobile view will be optimized for the smaller screen size and may appear slightly different than the desktop view. The respondent will be able to save their progress and move back and forth between devices should they need to do that. We estimate that this will take the online Qualtrics survey filling out would take about 45 to 60 minutes with a little bit of pre-work for each lead agency to complete. But it may take longer based on the pre-work you have, if you have any clarifications and questions. We understand that different business functions and responsibility may not exist in a single office, and the scan will permit the collaboration across these offices or organizations. Multiple respondents will be able to complete the different portions of the scan on their own as necessary. We recommend that the scan be completed collaboratively by the CCDF program administrator or program specialists and the IT specialists. We want to ensure we got the best and most comprehensive information possible. Please note that DISC will also be offering a more tailored version of the scan for the tribal lead agencies that speak to all these topics but may not be in the same format. Technical assistance such as webinars, office hours, instructions, and a glossary of terms will be made available to all lead agencies prior to and throughout the period during which the scan is open. More information on each of those events will be released in the coming weeks. So on this slide, you can see the difference in how the scan actually displays on a desktop compared to a smartphone. As more and more people access the internet and applications on the go, having the scan be available in both the desktop and mobile formats allows for DISC to tailor the experience to the lead agency's needs. DISC will be available to support you while the scan is open for completion. Following STAM, we anticipate the scan will be released via the OCC listserv to all CCDF administrators on August 7th. Survey links will be unique to each of your lead agencies, and all responses will be held confidential. We then have part 2 of our webinar. Part 1 was already published on our website, DISC website. And the part 2 of our webinar will be done on Tuesday, August 13th, during which DISC will provide a demonstration of the survey, platform functionality, preview reports that may be shared back with the lead agencies who complete the survey, and answer any questions about the scan. During the period when the scan survey is open for responses, we have 3 open office hours scheduled on August 14th, August 28th, and September 11th. These times are available to ask anything about the CCDF IT environment scan. You can ask about Qualtrics, you can ask about how you should engage with IT partners, or you can provide responses to any of the questions or clarifications you might have thereof as they relate to your data and IT systems, or even the business functions or the new CCDF rule. Lastly, as the scan closes on September 20th, DISC is available via email for any individual support that may be helpful to you. I know we've given off a lot of content here and shared. So before my friend Ray talks about the intensive consultation, let's open the floor for some questions that you may have regarding the IT environment scan. Any questions?
I see someone who looks like they might have a question.
Okay.
Yes.
Yeah, please come forward to the mic and thank you.
I am probably thinking way too far ahead. Felicia Gray, State of Illinois, and this is specifically for CCDF. In that scan and subsequent consultation, will there be some recommendations for how to connect this IT to other areas such as early interventions or other programs that we may be running?
So that's a really good question. Some part of the data that we'll receive from the scan as we're looking at the different business function areas and how it may affect other areas will be available to us. And as a part of intensive consultation with that IT strategic roadmap, that could be an area that we look into as well as we identify what the current state is, what the future goal is, as well as what are those gaps or initiatives that need to happen to get us to that future state. And then lastly, what does that order look like in terms of the different initiatives to make sure that you can get to the goal as quickly as possible?
Thank you.
Sure thing.
Okay, I'll ask my question quick. So we have a bunch of people that probably need to coordinate in order to do this IT scan. And I'm wondering if there's a possibility to like have the questions in like a PDF or a Word document that we can look at and think about before we're actually completing the online survey, because sometimes we have a hard time coordinating when the only option is to like answer the questions live time.
That's a good idea. We'll definitely take that back. But just to let you know, the Qualtrics platform, when it opens up on the 7th, you can actually see all the questions and skip through. You don't have to respond to anything. You can skip through and see all the questions. But you can then do your pre-work and discuss with different partners and come back and answer it. Because I think you have time till the 20th of September, right?
Right.
Yeah.
We'll take that back.
Yeah, but we'll definitely take that idea back.
Hi. I'm thinking overall, so I'm going to ask you a question, and it's going to be a little bit direct. So in Maryland, our systems in regards to our child care tracking and our scholarships, when we think about vendors, and I think we think about IT from you, I'm just wondering how direct information, how is that going to be? Because one of the things that we would always say, so let me just say this, is we would always say, it'd be nice if we didn't have to reinvent the wheel. So if there is one state that has a vendor that is awesome, I'm wondering, are we going to be able to get information in regards to that vendor? Because I know it's iffy when it comes to actually saying names, but sometimes we want names because we want to get it right.
That is a very good question. And I will say that I understand the level of iffiness. But one thing that we will say is that based on the data from the IT environment scan, what we will do is understand like agencies and identify areas or business functions in which there are agencies that have similar problems, or there may be an agency that's similar size or similar setup that may have already resolved that. And through the facilitation of our peer-to-peer learning opportunities, lead agencies will have the opportunity to learn from each other about what's working well and how to move forward, or some ideas about how they could implement some of those best or effective practices within their own lead agencies. Yes?
Just building off of that, are you considering open source solutions as something that you're going to ask about of the different agencies to figure out if there are ways to leverage, maybe instead of leveraging the same vendor, leveraging the same open source code package?
There are some questions in the scan that actually address the usage of open source. So one of the things we'd like to understand is, are you even using open source? Because there are some policies around that, and we'll have to look at where you are with the usage of that. So and based on the target state through the IT strategy roadmap, there could be potential recommendations, but I don't think there's going to be like direct vendor names that would be suggested that open source software is being deployed through, that we would come out with.
Yeah, I'm less concerned about the vendor specifically, but more
the
even
functionality.
more the function, and even if groups like haven't yet implemented something open source, if there is interest to potentially pool those efforts, I think that that would be interesting to know, to figure out if we could all build something together.
If you participate in like the environmental scan, what I'm gathering is that part of it is going to help us be able to see how we can, all these different systems can work together and be able to streamline some of the processes. Some of the discussions that California is having like internally is also like, how can AI be used to help us be more efficient with some of our reports or some of our work in that scan? Would you also be offering some of those type of strategies and how AI can be introduced in our work?
So what I will say is, as a part of intensive consultation, that IT strategic roadmap will evaluate initiatives such as that, if that is the goal and part of the future state of that lead agency. We'll look to see how we can, what does that gap look like, and what do those projects or initiatives look like, the cost, the structure, the scope, the timeline, to make sure that if that is what the lead agency would like to be a part of, as long as it's within OCC guidelines and policies, we'll be happy to take that into consideration as we're working with you side by side.
Okay, thank you.
Mm-hmm.
And I'll just say before we move on, we really appreciate all of these questions. Such a big part of our first year as a new CCTAN center is really making sure that we listen and we're hearing what are the concerns, what are the questions you all have, what are the pain points, what are you looking for from your peers, what are you looking to not reinvent, et cetera, et cetera. So we take notes every time we have conversations with you at all these meetings and take it back to our team and talk about it with our contract officer. And as you heard Dr. Friedman say this morning, this is such an important part of this process, is that we're hearing from you what are the issues around IT and data systems and CCDF. So we just really appreciate the questions, and just rest assured we're taking all of these back for considerations of what we can do to move them forward or get them answered, or think about what that TA related to these questions might look like in the next year. So we really do appreciate your questions and your thoughts. So thank you.
Absolutely, and we also would, just to tag on to what Meredith said, we're also looking at, improving the scan over time. So this will be an iterative process, because we expect this to be an annual scan.
Laura from Michigan. My question is, when you're talking about end user, parent, family ability to use, do you have like a set of best practices that you have already gathered for that you could share regardless of whether or not we participate in this scan? Because I know that's an area that I have come up against a lot in other roles, and I'm sure it's going to come up here too.
Yeah, that's a really good question. So through the data from the IT environment scan, one of the things that we'll be doing with that data is understanding what, like Meredith said, what are those pain points, those challenges, and those effective practices. And so from hearing what those effective practices are, with the permission of OCC and the lead agencies and regional officers, we will create universal TA options in order to help share those practices so that it's available for everyone. Any other questions? Okay.
Yeah, great questions.
Yeah.
Yeah. So Ray,
I will take it over. Intensive consultation. Intensive consultation is this individualized TA service that looks to make a large-scale and long-term impact on how technology is used to implement CCDF and ensure CCDF operates in the best way possible for each lead agency's constituents. Now, we understand the opportunities lead agencies are facing with updating, enhancing, or rolling out new systems, and intensive consultation provides that opportunity for us to work one-on-one with you all and provide you with access to subject matter experts in IT, technology, data, and CCDF operations using iterative human-centered design principles to develop and implement an IT strategic roadmaps. These roadmaps will reflect your unique data and IT needs and improve the experiences for families and children. And so, thinking about intensive consultation, I think it's really important for us to share that it is a relationship-based service where DISC works with lead agencies to help achieve their IT and data system goals. Now, these goals are, in the end, create better access, outcomes, and user experiences for families and providers. An intensive consultation will be delivered in 2 key phases. The first is that IT strategic roadmap development. And during this phase, CCDF lead agencies will work with a dedicated team of DISC staff and subject matter experts for approximately 6 to 9 months to develop an IT strategic roadmap relating to improving, enhancing, or building out IT and data systems to meet specific needs of lead agencies, families, and providers. Now, the second phase is an IT strategic roadmap implementation. And during this phase, select lead agencies will continue working with a dedicated DISC team to receive ongoing support and consultation services at no cost to lead agencies for up to an additional 24 months as they take actions to implement priority areas of their IT strategic roadmap. The request or application for intensive consultation will be available this fall, and collaboration between DISC and the selected lead agencies is expected to begin in January 2025 to develop the IT strategic roadmaps. Approximately 25 lead agencies will be selected for development consultation, and up to 10 lead agencies at a time will receive implementation consultation. Now, you may be wondering, what is an IT strategic roadmap? An IT strategic roadmap is a document that details key goals for implementing improved IT and data systems. It outlines the initiatives and steps necessary to achieve those goals. It defines the timelines in which those initiatives need to be completed to move towards the goal, and it identifies dependencies, and potential obstacles for implementing improved IT and data systems that meet CCDF requirements. Roadmaps are developed to give leaders an overarching plan and strategy for designing new IT and data systems, upgrade existing IT systems, and identifying which technologies are best suited to meet the organization's needs. An IT strategic roadmap helps to get you from where you are to where you would like to be. Now, without a roadmap, there are organizations and people that may get lost along the way and end up taking a route that they initially didn't plan, such as rolling out a new system and getting to the end and realizing it doesn't quite meet the needs that it was intended. In turn, it takes longer to actually get a proper system, and it costs more money. And so with that, an IT strategic roadmap is super helpful for making sure that we're staying true to the intent of the initiative. The IT strategic roadmap development will follow 5 steps over the course of approximately 6 to 9 months, and it will require frequent collaboration between DISC and the selected lead agencies during each step. The first is engaging with key players and document current state. And in that, we are identifying key roles and meeting with key staff to set expectations and understand the current state of the lead agency's CCDF system. The second step is documenting the future state, and this is where we want to understand what are those goals that you are working towards and rank those goals to aid in decision making. Then benchmark the goals to estimate potential outcomes and measure performance. Third is identifying gaps and opportunities, and this is where we're essentially analyzing IT and data systems impacting business needs and objectives to find strengths and weaknesses. This is where we're also looking at what are the gaps between where you currently are and where you're trying to be, so that we can understand any dependencies, any risks, any obstacles as it relates to infrastructure upgrades, organizational alignment, hiring, etc., that need to happen in order for you to achieve your goals. The fourth step is identifying IT strategic roadmap initiatives. And so here we're ranking the gaps based on the impact to the lead agency's goals. We're identifying the projects that are needed to fill those gaps and address it. Any resource issues we're trying to assess, estimate the cost as well as the timeframes, and sequence the projects based on dependencies. And then lastly, it's to draft and document the IT strategic roadmap to present to key staff for feedback, solicitation, and incorporate any changes before publishing a final IT strategic roadmap. Now, once the lead agency and DISC have completed their IT strategic roadmap, that second phase will begin. And it is where we're continuing to provide support for up to 10 lead agencies at a time. DISC consultants will act as a thought partner throughout various activities to help each agency manage aspects of roadmap implementation and ensure that changes made to their CCDF data and IT systems will provide lasting and long-term benefits to children, families, and providers served. The second phase of of the intensive consultation will require DISC to collaborate with the selected lead agencies in a very side-by-side manner, continuing that relationship-based service. The IT strategic roadmap implementation will occur through virtual meetings or on-site visits. And the frequency and number of those meetings will be determined through the review of the IT strategic roadmap and initial conversations with each selected lead agency to tailor the type of support required to achieve the desired outcomes. Implementation will look different for each lead agency, but will follow a standard set of steps. Key staff will need to be involved to review expectations and document project goals, scope, timeline, and budgetary considerations. Specific planning will then need to take place to define activities, assignment, and due dates for deliverables. And the last step will be the delivery of any work products and perform analysis to ensure it has met the expected outcomes. Now, more details about intensive consultation, the processes around it, and further explanation of key concepts will be explored in future DISC TA events. As Meredith mentioned, there will be webinars around intensive consultation and open hours, and so that is where you can gather more information about that. And now we do look forward to hearing from you throughout the next several months so that we can understand how we can support you with any IT system initiatives and are excited to begin directly working with you. So it hits home, and Meredith, thank you so much for calling it out. We're really here to listen, to understand. That way we can be of better help and support for you. So I know I described that second phase of intensive consultation very generally, and so you may be thinking, what does that really mean? What does that look like? DISC can be a partner in determining the best types of system modification or changes that may be needed to your specific program to support the 2024 CCDF final rule. We know that many lead agencies will need system changes to make enrollment-based eligibility and payments a reality, and DISC has helped to support the necessary IT enhancements. We can also help design projects to improve access to quality data so that data dashboards can be created to enable data-driven decision-making. Maybe your goal is to improve your online presence to be more user-friendly in providing data and information to families and providers. Some lead agencies may want consultation, on how to contract with IT vendors, determine requirements for data and functionality, and train staff for continuous system support. The goal is for lead agencies to utilize modern technology solutions that are flexible and can easily be modified to incorporate future changes as needed. Now, keeping that in mind, there are a few services DISC will not be able to perform or be able to participate in. These include source selection of IT services, the direct hiring of staff, direct development of data management and IT systems, writing, developing, or supporting system code, purchasing or funding of hardware or software, or grant policy approvals or policy directive issuance. To submit a request to participate in intensive consultation, we first have to look at the first phase, that IT strategic roadmap development. All state, territory, and tribal lead agencies are eligible and encouraged to request intensive consultation. There will be a short form where you will answer a few questions related to your data and information system goals, and lead agencies will need to meet some prerequisites to participate, including identifying an executive leadership champion that has authority to dedicate appropriate staff and resources to the project. DISC will review all application responses, consider several data sources that provide additional information on each lead agency, and make recommendations to OCC, who will make all final decisions on the selection. Considerations will be made on the impact of the request, equity for tribes and territories to ensure those interested will be able to participate, review of improper payments report, the 2024 CCDF final rule impacts, CCDF compliance, resource allocations, and other priorities identified by OCC. Initial contact between DISC and the selected lead agencies will occur following OCC's written notification of selection to introduce the teams and sign TA agreements. At the conclusion of IT strategic roadmap development efforts, the lead agencies involved will have the opportunity to apply for ongoing consultation and support services from DISC to achieve priority aspects of the plan over an agreed upon consultation period of up to 24 months. The application will allow DISC to evaluate the lead agency's ability to implement and complete the initiatives within the IT strategic roadmap in agreed upon timeframes. This application will ask for specific details about staffing and resources needed to accomplish the priority portions of your IT strategic roadmap and any roadblocks, risks that may hinder the work. Lead agencies, will be asked to describe how projects, align with key OCC priorities. DISC will review all applications, evaluate the scope of the project and readiness of the lead agencies, and potential impact of the project to recommend up to 10 lead agencies who will be provided ongoing consultation. OCC will determine and notify the participating lead agencies. Now, I know I have provided a lot of information on intensive consultation, and so really want to make sure that I provide an opportunity for you all to ask any questions that you may have. Anyone thinking of a question? Sure. So the first part of your question, I believe, is what is the time frame for developing the IT strategic roadmap? That will be about 6 to 9 months it will take. And then I couldn't hear all of your second question, I'm sorry. Yes, we'll share the IT strategic roadmap with the state agency. We'll be working in close collaboration with you about it. So it's not just DISC, just creating it and doing the evaluation. It's a partnership with us understanding your current challenges and your current landscape, what goals you have for your lead agency, and us making sure that we can recommend the projects that we believe will help you achieve those goals. So it is in partnership. We won't just take the data and say, okay, we'll talk to you in 6 to 9 months as we figure this out. It will be in continuous collaboration with you. Yes. Sure.
If the state is already in the process of developing data systems, do you go back and create that roadmap for you if you don't have it specifically the way you want it, or do you move forward with what we already have?
That's a really good question, and Unfortunately, I think my answer is going to be, it really depends on the scenario. But one of the things that DISC will be providing is a strategic planning toolkit. So for lead agencies that may not be able to participate in intensive consultation, that will be available for them to help them create their own IT strategic plans. But with your question, we can support as long as it's within the OCC priorities and guidelines of consideration.
Ray, I wonder if I could just tag on to
Sure.
that a little bit. It reminds me of something we heard a couple of times at the Denver Regional Cluster meeting, as we heard questions about, well, what if we have, as a lead agency, already have a vendor? Can we do an intensive consultation with you? What if we've already thought about working with a vendor? What if we haven't thought about a vendor yet? Wherever we are in that process, can we work with you? And the answer is yes, is that DISC will work in intensive consultation, like you said, kind of hand in hand. This is a partnership together. Wherever you are in this process, we'll meet you where you're at and together develop a roadmap that's reflective of what you've done, where you want to go, et cetera. So anywhere you are in that IT or data journey, you're still eligible to apply for consultation.
Deb Swinson-Klatt, Minnesota. Your response actually spoke to, I think, a part of my kind of half-formed question. Minnesota is going through a major systems transformation initiative, building a provider hub in Salesforce, on the Salesforce platform. We're interested in the IT, potentially applying for the IT scan. So my question was really, with the experience we've had with our vendor building out the provider hub in Salesforce, we've experienced multiple discovery processes. So is the intensive consultation something akin to a discovery process that a vendor typically carries out? Or how would you characterize it as different than a typical discovery process?
So I think I'm sorry, the answer is it depends on the unique challenges and considerations needed for that as a part of intensive consultation. That could be how we support you in intensive consultation. It just really all depends on receiving all the information about what is happening in order to help us make that decision. So that's the best I have. Any other questions? Okay, I know I'm the roadblock. And so with that, I just have a few more slides for you. Over the next few months, DISC will provide some technical assistance events for the CCDF IT environment scan. We'll have a peer learning session, the IT Matters, in which our focus is IT procurement. And then lastly, the intensive consultation webinar and office hours that we mentioned earlier. The CCDF IT environment scan related events, you will have an opportunity to learn about the purpose, goals, benefits, and outcomes of the CCDF IT environmental scan and receive further instructions on completing the scan. You will also have an opportunity to access additional resources, ask any questions during the open office hours, visit and leverage the webpage post. See, I used that leverage word from this morning on jargon. And other materials we will provide alongside the webinars to share additional information. Lastly, DISC will host a webinar, as I mentioned, on intensive consultation, which is our individualized TA. And again, you will have the opportunity to receive additional resources, how to request the intensive consultation application, frequently asked questions, and schedule any open office hours, that you need in order to fulfill the application or receive additional information. And so please keep an eye out for the announcements over the next couple months and any information that we may share. And so before we conclude, I do want to make sure I provide one more opportunity for questions. I know I saw a few folks noodling, and so just want to make sure that if we have a question, we can make sure we answer it, unless you would like to do so privately. We're happy to answer it after the presentation. Okay. And so if you're interested in learning more about DISC or want to engage with us, you're welcome to reach out via email or access information via the DISC website. We are sticking with the QR code theme, and so we have created one and have one up for you to access our website. Thank you so much for your time this afternoon, and we really appreciate you sitting with us, asking us the questions, and learning more about our center. The more we're able to learn about you, the better TA that we can provide, which also means the better support that we can help you provide to families, children, and providers to help make that impact. And so we truly appreciate your time this afternoon. Thank you.
Thank you.